On the other aspect, there's the IHR, the higher channel. US is still a state party to IHR, and information is being shared through South Africa. NFP communicated with the US, and back and forth communication is going on. But how does that translate in a global solidarity? I will let time to tell, but we really need this incident, this outbreak has seen why the world needs a global entity that coordinates this. The Argentina support how they came forward. The support we are receiving now from US institutions as we live in an interconnected world, that outbreak from one part affects everywhere. So in terms of collaboration, we are going both through the technical collaborations, in sharing information, guidance. We rely heavily as DG multiple sides. What I'm saying is that the expertise of USCDC is an asset for the world, and we have been benefiting from that, and we will continue, and then we go through the IHR channels in sharing formal information and a technical exchange.
And Anaïs Legon, please.
Yes, I just would like to emphasize the excellent collaboration on a technical standpoint to date with my counterpart at the US Center for Disease Control. And this includes sharing of technical assessment, discussion about, very specific aspects, and sharing regularly what is known and what is not known. We have very positive, regular interaction almost every single day. So I just want to acknowledge, among other national counterparts, this is very useful.
Thank you very much, both. Now, oh, pardon me, again.
Yeah, no, I just wanted to add to what colleagues raised. Thank you, Helen, for that important question. As we speak, things are going actually as it used to be, meaning sharing information from our side. And also we're getting information from the US side based on the IHR regulation. And as you know, the WHO's mission is to, help the world to be safe. And our mission includes the US, which is we want the American people to be safe as well. So we will continue to collaborate from our side and continue to give information. So the disease is not a problem in the US and the rest of the world as well. But as colleagues indicated, this is what makes a platform like WHO very, very important. Health security needs universality. And any vacuum, any space which is not covered actually gives advantage to the virus. And the best immunity we have is solidarity. So because of the event that's happening now, and both Argentina and the US are affected, I think they will reconsider their decisions because they can see how important universality is for health security. Because viruses don't care about our politics, and they don't care about our borders, and they don't care about, all the excuses that we may have. So I hope this could be a good lesson for the whole world, because solidarity is our best immunity. I repeat. Thank you.
Thank you very much, Dr. Tedros. Then now we go to Ireland, to Neil Michael from the Irish Examiner. Neil, please go ahead and mute. Do you hear us? You're still on? Neil, if we can't grab you right now, then we go on to NPR, Gabriel Emmanuel. Gabriel, please try, and we'll come back to Neil afterwards. No? Oh.
Hi, yes. Thank you so much for doing. Thank you for doing this. I wanted to follow up on that point about the U.S. Engagement here. Typically, my understanding is we would have had press conferences and health alerts and other information coming out of the US CDC and NIH. We haven't had that, and I'm wondering, you say they're participating in terms of a technical capacity. Have they sent a team over like would typically happen? Can you get into some more specifics about what is missing or what is different about this situation now that they have left? Thank you.
Thank you very much, Gabrielle. And we go to Dr. Abdi Mahmoud. Or Dr. Chikwe first.
So thank you very much. Our colleagues have explained in detail the collaboration with the US CDC in the response that we have managed on behalf and in collaboration with many countries around the world. And we're very grateful for that. How many teleconferences they hold to the people in the US is obviously the responsibility of the US and the US CDC, and we'll leave that responsibility to them. But however, to highlight one thing, one of the core requirements of the IHR 2005 is for countries to build the core capacities that they require to do the work that we do. And in this response, we've really seen the output of that. The institutions across the world and the collaboration between them, from South Africa, the UK, Spain, Netherlands, Cape Verde, the national public health institutions, the national public health officials have really worked together with each other, supporting each other, sharing information, sharing reagents, sharing knowledge to respond rapidly to an emerging situation. So I think in all of this, we see the value of one, the IHRs and what it stands for, and secondly, the implementation of the IHRs, both in real time, but also in the longer term capacities that countries have built around the world. And it is on that we build this universality that our Director General just commented on. One is the principle of universality, but secondly is the implementation of it through the institutions that represent that in all the countries around the world. Back to you.
And now Dr. Mahmoud, please.
Dr. Chikwe has covered the main point. I just wanted to answer there so that we have clarity. And it repeats again to the other question, is this pandemic, is epidemic, and how we deal with it, and how US institutions like USCDC is dealing. These are limited epidemic confined in a cruise ship. Idea of sending messages across the world and panicking everyone is not required. And I think I want to go to the contacts and the passengers in the US being contacted and traced. We believe so. And we haven't formally heard from that, but informally, we're aware that rightful action is being done. So there's no need of panicking the entire population there and creating this, the largest epidemic is going to happen. So I just want to take this opportunity when we look at comparing institutions and that is, are there public health action being taken in each of the countries where NFP South Africa has shared? Yes. Are we getting feedback? Yes. And each country will have a different approach how they deal with it, and that's their own. So I just wanted to take that point answering the specific question, how is USCDC, why is no alert being sent? Because what we have there are passengers who are contacts who went back to the US who are now currently being traced by the local authority, sharing information to USCDC, and hopefully through the IHR channel, sharing back information to WHO.
Thank you very much, Dr. Chikwe, Dr. Abdi. Next question, we try again with Neil Michael from the Irish Examiner. No? Has dropped. Then we go on to Janice Koo from Bloomberg in South Africa. Janice.
Hi, thanks very much. I wanted to find out how long does it take to get the lab test results for the Andes virus currently, and is a specific assay needed? Just related to that, and some clarity on an earlier question, the KLM flight attendant who had contact with the second patient who died, that flight attendant's been hospitalized in the Netherlands, and I was wondering, is she symptomatic, and when can we expect to know her test results?
So first was about time, and then Dr. Anaïs Legrand.
No, doctor. Thank you. Yes, this is a very important question about how long the tests are performed. So the PCR is a technology that is being used, and countries are scaling up their capacity to ensure there are the adequate reagents. As you know, this is not a very common virus. So we are supporting countries to ensure there has the capacity to test should they have alerts. If reagents are available, the PCR performed is fairly quick in a matter of hours. And just to mention as well that there will be complementary testing using serology, which we are also helping countries to prepare for. That's for the first question.
And just on the second question, very briefly, so it adds on to what Anais has just said. It depends on the type of test that's actually being done. Certainly any of the contacts, including the one that you've mentioned, the flight attendant, will be isolated and testing will be done. I don't have a specific time for when the test will be back, but we are in regular contact with the Dutch authorities to receive that type of information. So as soon as that is ready, it gets reported back to us as well, and of course to the patient themselves. But it will depend on the type of sample that's done, the type of test that's done, for the timeline and when the results will be back. But I can assure you that everybody that is involved with this is just as eager to do the testing as quickly as they can, as long as they have the right materials. And again, we are supporting several countries with reagents to be able to test for this Andes virus. And as Anais has said, this is not a very common virus, mainly found in the Americas. So we're trying to provide support as one of the functions of WHO to ensure rapid diagnosis of any person that is tested for this.
Thank you very much, both. Next, we go to Le Monde. Delphine Roucault. Delphine, please go ahead and unmute. How does it look like? Then we're...
Sorry, can you hear me,
here you go.
please?
Now we're good, yes.
Yeah, perfect. Thank you for this briefing. I just have a question. When will we have more information about the virus sequencing, and any differences observed compared to the strain from the 2018 outbreak in Epuyen that you mentioned earlier? Will we be able to identify which mutations are cause for concern? Thank you.
So I did not understand everything, but I think we got it. Yeah, then we start with Anaïs Legon.
Yeah, if I understood correctly, it's about the genomic sequencing, and you actually pointed out toward very interesting information that we are looking at. We are awaiting the result from both South Africa, Switzerland, and Institut Pasteur Dakar, who are all putting all their effort into performing the full genome sequencing of that virus. The full genome sequencing, if good coverage is obtained, will be very useful for us to see how it clustered compared to previous outbreak, as you rightfully mentioned, especially that last outbreak you referred to. And it will give us a sense of whether or not we are seeing some changes. And again, we have to acknowledge the tremendous work that are being done by these three laboratories that I mentioned and all the international support that they have received to date.
Can I just want to add to that, because I think, again, this is another example, of having rapid sequencing being done by these three labs who are really exceptional labs. But the sharing of sequence information, particularly when you have outbreaks like this, can provide a tremendous amount of detail. And this is important every event that we have. Not only are they doing this work as rapidly as they can, but we have pulled together expertise in Andes viruses, and they will be debating, of course, what they see there and comparing with the other sequences that have been shared. We discussed this a lot up on this panel here, and we've been discussing this a lot with the pandemic agreement and the PABS annex that people have been discussing, the critical importance of sharing information, but not just that, actually bringing together people to do that risk assessment. What does it actually mean? So from the information we have so far, and they're still doing the sequencing, we haven't seen anything unusual, but that's why we bring together the best minds to be able to do that. And again, that includes people from Argentina who have specific experience with this particular virus, and now we will have more people around the world. So as soon as we know, and as soon as that analysis is done, of course, we will share that information as necessary.
Thank you very much, both. Now we move back to Germany. Deutsches Ärzteblatt, Valentin Frimmer. Valentin, please go ahead and unmute. Valentin? Otherwise, we come back to you. No, you're coming? If we don't get
Yeah,
to you, here we go.
Can you?
Yeah, it's
Sorry. Hey, Valentin Frimmer, Deutsches Ärzteblatt. Thanks for the conference. My question is, so we've learned already that the incubation time is relatively long. So my question is, so with the view on the people in isolation, how long do they have to be in isolation before they are tested negatively? Because so, or in other words, how much time does it take at most until the antibody or PCR tests are positive? I hope this was clear.
Thank you for the question. We start with Anaïs Legon.
I hope I understood your question correctly, and sorry for that if I didn't. Your question is how long after symptoms is the PCR detecting the RNA? Is it correct?
Or how long would people need to stay in isolation to be sure that they're not infectious?
So what we know is, yes, the incubation can be up to 6 weeks. And for that time, contacts who have been potentially exposed need to monitor their health for any sign of symptoms. The RNA of the virus can be detected in a symptomatic person, so someone who is ill, from the first day of onset.
Thank you very much. Next question, we go to Globo, to Brazil. From Globo, Bianca Rotier. Bianca, please go ahead and unmute.
Hi, can you hear me?
Very well.
Thanks a lot. Good afternoon, everyone. A follow-up on this point, because you said 6 weeks monitoring, but does it mean 6 weeks of isolation? And now my main question, what is the mortality rate of the Andes strain of hantavirus? And just as I'm covering this story for the Brazilian television, my understanding is that the Andes strain of hantavirus is also present in Brazil, correct? So should Brazil's health authorities reinforce protocols for cruise ships after this case? Thanks a lot for your attention.
So the first was the specification on the 6 weeks, and then the question whether this virus is also present in Brazil, and whether protocols should be adapted.
And the mortality. Yes. So maybe I will start with the mortality, and I might let colleagues to complement on other aspects. A high mortality has been observed in previous outbreak. This is true. But we are emphasizing the importance of early supportive and intensive care. And this is why we are also putting in place these contact tracing measures. It is very important that any patient can be admitted to a safe and adequately equipped with trained staff to ensure that patient can receive the level of care that is needed in case they present severe presentation and deteriorate. So hopefully with early care, survival can be improved. In terms of virus circulation in Brazil, I'm not sure if there was a question, but any country who have antiviruses, not just Andes, should obviously scale up their surveillance system and One Health approach to understand where this virus, in which, animal, rodents, the virus circulate, and ensure that interaction with rodents can be minimized or conducted safely to avoid rodent to human transmission in countries that have the virus present in their reservoir.
Thank you very much. Maybe to add on the hantavirus as such, and
the question,
yeah.
yes. So no, thank you very much for the question. So Anaïs had described earlier, and we'll talk in general, but then specifically about the situation with the ship and the people who are in contact. Certainly, we have the incubation period of up to 6 weeks. That doesn't necessarily people need to be in isolation for 6 weeks. What is really important is that people have the right information. We understand what their potential exposure is so that we can understand their risk. Contacts are not all the same. Some contacts have a higher risk of exposure and therefore a higher risk of infection, and others have less. So what is happening currently right now on the ship We have a WHO expert who is on board, together with an ECDC expert. We have 2 Dutch infectious disease physicians who are on board. They have received protocols. They're asking questions related to the exposures of the people on board to really understand, what type of contact did they have with any of the suspected cases or confirmed cases, and what did they generally do on the ship, before they got on the ship, during on the ship, and then looking at what type of exposures and what type of risk that means. With that risk assessment that's being done, there is a step-by-step plan that is being developed, and it's currently in develop with many different experts to be able to say, once that ship docks, what will happen as it goes on board. So that is currently being developed now. What is really critical is that people have the right information. This also includes people who disembarked in St. Helena, people who have been on board. If you are developing any symptoms, to present yourself to healthcare and just say, this is my potential exposure, might be hantavirus, and then you'll be isolated and tested and provided care. So what we're trying to do is take this in a staged approach. But I do want to reiterate, contextually, what we're talking about, the risk to the general public is low. Hantaviruses are relatively uncommon, even though there may be thousands of cases estimated each year. This is a particular situation where we are monitoring. I think it's great we're raising awareness about hantaviruses in general. It's great that countries are paying attention to this, and hopefully governments and increasing their surveillance efforts and really critically using this One Health approach, because it is predominantly in rodents and that's how people get infected. So this is why, as Chikwe has said before around the IHR, the core capacities in countries for early detection, good surveillance, having good public health systems is critical. So whatever is circulating there, we have the right facilities in place to keep people safe.
Thank you very much. And Dr. Mahmoud?
Just a small clarification on the question was isolation, and WHO, not to be pedantic about the use of word, isolation are confirmed cases who are symptomatic. So I just wanted to put in context. And then the second, the context people who've been exposed to infectious, we are recommending right now active monitoring. What does that active monitoring means? Each country will have a different approach. Some countries are now introducing institutional quarantine where people will be put, but we have to remember most people don't have putting people in 6 weeks are different. So we leave that decision from our WHO side. The most highly are the cases and confirmed which needs to be isolated. And then the contacts needs to be followed, duration up to maximum of 40. How does that happen? Active monitoring is the daily visit by healthcare workers. Is it we put in an institution? It will change. But just to break the chain of transmission, we have 2 different approaches. One is the isolation of confirmed cases who we know they have infections, and people who are at risk who maybe have been exposed, where we call active monitoring, and different countries use quarantine, institutional quarantine, and all that policy. I just wanted to separate what WHO is recommending. Isolation of the confirmed cases and the active monitoring of the exposed people who may be at risk. How is that implemented? We may change from one country to another. And then take the maximum duration of the 42 days. If you look at what we have seen right now, within 2-3 weeks, the people, when they got exposed, they had the onset of disease. But the clear guidance shows up to 42 days. So that's the maximum that we are recommending, active monitoring of those people who have been exposed.
Thank you very much to all the 3 of you. Now we come to political. Rory Neal. Rory, please go ahead.
Hello, thanks very much. Yeah, I'm just curious about what happens when passengers disembark. Okay, you just clarified your guidance on isolation there, but like, should passengers be going on commercial flights back to their countries when they disembark, and would you have any concerns around that? Yeah, thank you.
So the question, how should the passengers now who disembark, how should they move on with them?
I will start, and probably my colleagues will complement me. Yes, a step-by-step guidance is being developed to make sure that all passengers and crew members are supported throughout this journey. Don't forget what they've been through. And so WHO is coordinating with national health authorities to streamline recommendation and guidelines on that, and to ensure that first, as my colleague says, that anyone who would have any sign or symptoms can be properly isolated and cared for, while all passengers are being evaluated for their risk exposure, to be able to inform them on what are the recommendations moving forward. So this is still work in progress. The evaluation is already ongoing in the boat, but further guidance is being streamlined and developed.
I think if I could just add to that, so as you know, there's a lot that's currently being discussed right now. I did want to specifically mention that we are working with all of the countries who have nationalities that are on board to discuss the plans for the safe journey of those patients home. Once they disembark, once they are medically evaluated, what those decisions will be, and as Anais said, that is currently being developed. It needs to be very carefully done, but we are working with the countries about that onward passage home. So I just want to assure, and we are also working with the ship's operator because of the crew. So remember, on board, we have passengers from many different countries. We also have crew from many different countries, and everyone involved, all of the governments, the ship's operators want to make sure that they get home safely, not only minimizing their own risk, but any risk to others. So that is currently being developed. And as those plans are announced, then we will make those available. But there's active discussion about how that will be done as safely as possible.
Thank you very much, both. Next, we go to the Globe and Mail. Mustafa Al-Assar, please.
Hello, can you hear me?
Well.
Thank you so much. I appreciate your time. Can I ask about the medical condition of the Canadian passengers, including the 2 Canadians who have been evacuated in April? And you have mentioned that all governments, you are in contact with all governments. Can I ask whether the Canadian government has been in contact with the WHO regarding their safety or evacuation? My next question is, what is the WHO protocol for contact tracing in details? And also, we have been monitoring 2 live streams from the ship. In one, the streamer appeared distressed, was crying, and was asking for help. In the other, the streamer seemed calm, and they stated that people on board were not under stress, take the situation seriously, but without panic. He said to us that the situation appears to have been extremely overstated. Could you please clarify this contrast? Thank you so much.
Thank you, Mustafa. A bit more than one question, but let's see.
I heard 3. I'm not sure if I got the first question, which I think was related to Canadians if we're working with the Canadian government. We are working with all of the governments. I mean, this is what WHO does, right? We are a member state organization, and we work with all governments, and they are working with us as well about the people who are on board. I think your last question, I didn't get the second question, but I think your last question was around the passengers who have either live streamed or said that they were under some distress on the ship. Yes, we've seen videos, we've seen that video, and in fact, in some earlier interviews, I was trying to address directly the passengers that are on board because we hear them. As you know, the DG has been in contact with the ship's captain several times and discussing, you know, the captain is doing the best that he can to provide the right and appropriate duty of care for those people who are on the ship. We hear them. We are working with many, including, you know, everybody on board to ensure not only do they have medical support, and that's why there are 2 additional infectious disease doctors from the Netherlands on board, but also providing some psychosocial support as well. This is quite frightening for those who are on board. They want to have the right information and regular information about what's happening. Our understanding right now is that the morale has improved because the ship is moving and plans are being made to get them safely to shore and for their onward journey home. So yes, we have heard that, and I think what you highlight here and what I would like to emphasize is that it's not only the clinical care, but it's also care for people's mental health. And it's really about making sure that they have good information so that they can take action, because of course there is a worry on the ship, but we understand there's also a worry out there. And again, this is why we're trying to answer questions, to just put this into context of what is actually happening. And again, the risk to the general public is low.
Thank you very much. And I think although we have still many questions left, we are ready to take one more, and that one goes to Sarah Nui from The Telegraph. Sarah, please go ahead.
Hello, thank you so much for doing this. I just wanted to talk quickly about medical countermeasures. There obviously aren't any treatments or vaccines available. Is that a blind spot in global pandemic preparedness, and which teams are kind of furthest ahead? If this did escalate, how quickly could we get a vaccine, for instance? Thank you.
Anna-Isle Gonigen.
Yes, thanks. Very important point. Currently, there is no approved medical countermeasure if we are referring to antiviral treatment or specific vaccine targeting this specific virus. However, as you know, there is a coordination around research and development blueprint that is supported by WHO to ensure that all priority viral families can timely develop such countermeasure. And the antivirus are a big family that is considered under a cork, what we say. So WHO encourages scientists and countries to join efforts and to see how feasible it is to develop life-saving countermeasure. But I want to re-emphasize the importance of early, supportive and intensive care as soon as possible as a patient has symptoms, as this can save life. And of course, we welcome additional countermeasure. I leave my colleague.
If I can, yes. So the R&D blueprint for epidemics, which was established by WHO following the Ebola outbreak in West Africa, in 2017, we outlined priority pathogens. And from there, these are priority pathogens that have an epidemic or pandemic risk that didn't have medical countermeasures. And a lot of work has happened over the last almost 10 years related to the development of better diagnostics, better therapeutics, better vaccines for pathogens that we know have a risk. Recently, the R&D blueprint has moved to more of a pathogen family approach so that we take a more holistic view of how research is done to advance, what could be done ahead of time, ahead of that next outbreak, ahead of that next pandemic. We benefited from that from COVID, for the work that was done on SARS and on MERS and on RNA technology. And this is what we want to continue to see. So that investment in research, that investment in innovation, the investment in the coordination of people who are working on this. We're very grateful for that from a technical point of view, the work of CEPI, the work of many others who are advancing this type of work. But that needs a regular attention, regular investment, and also follow-up. So what are we learning? What actually needs to be done? So the R&D blueprint is working very hard on many different types of pathogens with epidemic and pandemic potential. And as Anais has said, this is one in a family of viruses where this approach is being taken. So those of you who are out there who are doing research in this area, thank you very much. Those of you who are out there who are funding research in the area, please continue to do so because it is urgently needed, because we are always preparing for the next outbreak, the next epidemic. And I want to reiterate again, this is not the start of an epidemic. This is not the start of a pandemic, but it is a good opportunity to say that investment in pathogens like this are critical because therapeutics, diagnostics, vaccines save lives.
Thank you very much. Before I hand to Dr. Tedros for closing remarks, let me just say, any further questions, please send to us, thanking the panel. And now over to Dr. Tedros.
No, I was going to add to the question about Canada. We know that the Public Health Agency Canada is following up on the 2 Canadians who have disembarked at St. Helena. And of course, the other 4 in the ship are also being followed by other relevant authorities of Canada. That's one information I just would like to add. And then on closing our session, today. Thank you so much to all members of the press for joining us. And as needed, we will continue to keep you updated. Thank you so much. All the best.
Dr. Tedros Adhanom Ghebreyesus, our Director General. Then I start from the panel, on the podium here on the left side. We have Dr. Maria van Kerkhove. She's Interim Director of WHO's Department of Epidemic and Pandemic Management. Then we have Dr. Jeremy Farrar, Assistant Director General for Health Promotion, Disease Prevention and Care. And Dr. Sylvie Briand, WHO's Chief Scientist. Ms. Sigrid Granavetter, Director for Governing Bodies. And last but not least, Mr. Raul Thomas, he's Assistant Director General for Business Operations. Welcome. We have a couple of other colleagues in the room and online, but I'll introduce them in case and when we get to them. So with this, over from my side, and Dr. Tedros.
Thank you, Christian. And good afternoon, and welcome to our friends from Akanu. It's an honor to host you once again here at WHO headquarters. And congratulations to Dina for your appointment as president of Akanu. And thank you also for recognizing our colleague Fadila. Of course, I will come to her later at the end of my statement. But Dina, as I said earlier, it feels actually different when you meet in person like this, and feels not only different but better than virtual. So we would be happy to have you more often. And my thanks to Akanu President Dina Abdi Saab and all Akanu members for your continuing interest in the work of WHO. This is a busy and critical time in the lead up to the World Health Assembly next month, where several critical issues will be considered. The most significant is the Pathogen Access and Benefit Sharing System, or PABS, an annex to the WHO Pandemic Agreement, which member states adopted at the Assembly last year. As we speak, member states are negotiating the text of the PABS annex in this building. And they have come a long way, but they still have more work to do, and key differences remain on key issues. Nevertheless, where there is a will, there is a way. And I still see a common will to reach consensus, which means I continue to believe there is a way to reach consensus. The PABS Annex, as you know, is the last remaining piece of the puzzle of the many initiatives that WHO and our member states have established in response to the lessons of the COVID-19 pandemic. Over the past few years, WHO has taken several steps to make the world safer from future emergencies and pandemics. And one of those was to strengthen capacity for local production of vaccines and other tools through the mRNA technology transfer program based in South Africa, Cape Town, and the WHO Biomanufacturing Workforce Training Initiative based in the Republic of Korea. Today, WHO announced that we have designated regional training centers in each of WHO's 6 regions to build the skilled workforce needed to sustain local production of vaccines and biologics. The new training centers are in Brazil, China, Egypt, India, Ireland, Senegal, and South Africa. They will operate as part of a coordinated global network, delivering context-specific training aligned with regional priorities, regulatory environments, and languages. Another way we're building national capacity for emergency preparedness is through simulation exercises. Earlier this week, WHO held exercise Polaris 2, which stress-tested how systems respond to a fictional outbreak of a bacterium spreading across the world. Exercise Polaris 2 involved 600 health emergency experts and 25 partner organizations from 26 countries and territories from all regions and income levels. Exercise Polaris 2 is part of Horizon X, WHO's multi-year simulation exercise program. It provides a vital platform to test emergency frameworks under real-life conditions, ensuring that collective readiness is not a periodic effort, but a continuous investment. Now, turning to the Middle East, where the ceasefires remain fragile and peace discussions have stalled. In Lebanon, strikes have not stopped, and deaths and injuries continue to be reported. More than 1 million people are displaced. Some are trying to return to their communities and homes, while others stay in collective shelters with scarce living conditions. 50 hospitals and primary healthcare centers are closed, and 16 hospitals have been damaged. There is a lack of adequate treatment for people who are injured or living with diabetes, hypertension, and other non-communicable diseases. At the very time they need the health system most, it has been weakened. Since the conflict began, WHO has verified 149 attacks on healthcare in Lebanon, in addition to 26 in Iran and 6 in Israel. These attacks have resulted directly in 111 deaths and 233 injuries, mainly in Lebanon. As we always say, the best medicine is peace. Now to Haiti, where armed gangs are controlling an estimated 90% of the capital, Port-au-Prince, and are extending their control to other parts of the country. More than half of the population is now acutely food insecure, and more than 1/4 of children under 5 admitted to health centers are acutely malnourished. In Port-au-Prince, half of all inpatient health facilities are closed or have been destroyed, and only 1/3 are fully functional. Sexual violence, including collective rape and sexual exploitation, is increasingly used by gangs as a tool to coerce communities and assert their dominance. 40% of the population, 4.4 million people, have no access to essential health services. A large outbreak of diphtheria that began earlier this year has so far caused 469 cases and 7 suspected or confirmed deaths. WHO is supporting a national response plan, which includes a vaccination campaign targeting almost 600,000 children. So far this year, WHO has delivered almost 30 metric tons of medicines and medical supplies to 16 health facilities and partners. We're also supporting the only public referral hospital in Port-au-Prince, which has enabled more than 7,000 patients to access free emergency care and more than 450 women to benefit from cesarean sections. But we urge the international community to give the right attention to Haiti, which is in a serious crisis. Despite the many problems in our world, there is also much good news to celebrate. For example, today WHO announced that we have validated Australia for eliminating trachoma as a public health problem. Trachoma is the world's leading infectious cause of blindness and was especially prevalent in Australia's indigenous communities. In 2006, Australia began a national program to implement the WHO recommended strategy on trachoma. It has now become the 30th country globally to be validated for eliminating trachoma as a public health problem, and the 3rd this year after Libya in February and Algeria earlier this month. In March, Chile was also verified for elimination of leprosy. Since 1997, WHO has confirmed the elimination of a neglected tropical disease 90 times in 63 countries. It shows what's possible with political commitment and the right tools. And it's not just entities. Just last week, WHO validated the Bahamas for eliminating mother-to-child transmission of HIV. Malaria is another example. Over the past 70 years, WHO has certified 47 countries and 1 territory as a malaria-free, and many more countries are on the path. New tools are giving us hope of finally seeing a malaria-free world. Last Saturday, the 25th of April, was World Malaria Day. To mark that day, WHO announced that we have pre-qualified the first malaria treatment developed specifically for newborns and infants. Until now, infants with malaria have been treated with formulations intended for older children, which increases the risk of dosing errors, side effects, and toxicity. This new formulation of artemether lumefantrine helps to close a long-standing treatment gap for some 30 million babies born each year in malaria endemic areas of Africa. Earlier this month, WHO also pre-qualified 3 new rapid diagnostic tests that can detect strains of malaria that older tests miss. Pre-qualification is WHO's stamp of approval for quality, safety, and efficacy, and will enable public sector procurement of the medicine. Together with vaccines, new diagnostics, and next-generation mosquito nets, it's another step towards a malaria-free world. Another area in which the world has made substantial progress is against hepatitis. The World Hepatitis Report, published yesterday, shows that since 2015, the annual number of new hepatitis B infections has dropped by 32%, and hepatitis C-related deaths have fallen by 12% globally. Thanks to vaccination, hepatitis B prevalence among children under 5 has also dropped to just 0.6%, with 85 countries achieving the 2030 target of 0.1% prevalence or less. Countries including Egypt, Georgia, Rwanda, and the United Kingdom are showing that eliminating hepatitis as a public health problem is achievable. However, more than 1.3 million people died from hepatitis B and C in 2024, and 287 million people are living with this disease. The vast majority lack access to treatment. We have the tools to prevent, diagnose, and treat hepatitis. WHO calls on all countries to scale up access to these tools. Finally, tomorrow marks the end of World Immunization Week, an annual reminder of the life-saving power of vaccines. During World Immunization Week in 2023, WHO, Gavi, and UNICEF launched the Big Catch-Up, an initiative to reach children who had missed out on vaccines, including during the COVID-19 pandemic. The Big Catch-Up concluded at the end of last month and was a great success. Together, we delivered over 100 million vaccine doses to an estimated 18.3 million children in 36 countries. That includes 12.3 million zero-dose children who had not previously received any vaccines and 15 million who had never received a measles vaccine. Measles is a perfect example of the power of vaccines to eliminate diseases from communities and entire countries. Globally, 95 countries have been verified for eliminating measles and 115 countries for eliminating rubella. However, elimination status can be lost, and there are still millions of children globally who miss out on essential vaccines every year. The WHO is continuing to work with Gavi, UNICEF, and other partners to support countries to reach those children by expanding routine immunization programs as part of every country's journey towards universal health coverage. And finally, as you may know, our dear friend and colleague Fadila Shaib is retiring from WHO. Fadila has been with WHO for 25 years, and for the past few years, she has led our media relations team here in Geneva. So you know her very well, and that's why the recognition comes. And thank you again, Akan, for recognizing her. And many of you have known and worked with Fadila for years. She has played a vital role in helping to tell WHO's story to the world. I know that you will miss her, just as we will. Fadila, thank you for your service and dedication. Shukran jazilan. We wish you every success in the next chapter of life. You're a very special person. Once again, shukran. Once again, many thanks to all of you for joining us today, and we look forward to your questions. And Christian, back to you.
Thank you very much, Dr. Tedros, and thank you, Fadila. We'll start with a round of questions. As this is recorded, please introduce yourself each time. And we'll start here with Christiane, please.
Thank you. Thank you, Dr. Tedros. It's Christiana with the German Press Agency. Thank you for the update on all the successes. I would like to hone in on one that is still in the making. What do you make of the negotiations on the PAPS annex? Time seems to be running out, and are you afraid that the pandemic treaty might be a toothless tiger if this doesn't get over the line in the next few weeks? Thank you.
Yep, thank you very much.
Thank you. Maybe I should respond. Thank you for this question. As you know, our member states are negotiating as we speak. I was in the room, actually. I just came straight from there. Sorry for being a bit late. I was there in the room. And they're trying their best. They're working very hard. And late nights, early mornings, and I can't tell you the level of commitment that they have, and I know you have already seen that. I think from all sides there is commitment, goodwill to finish the job. And they're trying their best to find a middle ground, because there are areas where there are significant differences. And my hope is that they will finish during this week. Then, of course, the conclusion of the PABS agreement is important, because we cannot start the ratification process of the pandemic agreement without concluding a deal on the PABS. So this is, as I said in my speech, the last puzzle, the last piece in the puzzle. And we hope they will agree. But not only that, the pandemic agreement with the PABS annex will also bring all the initiatives we have started based on COVID lessons together. As you know, the Pandemic Intelligence Hub that was established based on the weakness we have identified in surveillance. Our surveillance is much better now. And the BioHub, because there was a problem in sharing samples. That's why the BioHub is up and running. And capacity gaps at country level. That's why we have the UHPR, the peer review mechanism, and also the pandemic fund to fill the gaps at country level, because no one is safe until everyone is safe. And especially capacity at national level is important. And that was also based on lessons learned during the assessments that the gaps at the country level were the reason behind some of the weaknesses in the COVID response. And of course, problems related to equity. That's why we have the technology transfer hub in Cape Town to encourage local production, and the medical countermeasures the same to ensure or to address the equity gaps. But all this, and you know, the emergency corps as well, all this will be coordinated and led properly from end to end, from prevention to early detection and response when we have the agreement. So the agreement is actually the key in all the initiatives we are doing based on the COVID lessons. So that's why it makes PABS also critical, because the pandemic agreement can only start its ratification with the PABS. And member states understand this, and that's why they're trying their best. And I hope they will conclude, and then we move on. And I see some positive developments. But they still have 3 days. I think the rest of today, the Thursday, Friday, and Saturday. And of course, any time between now and the beginning of the assembly as well. So I think they will do everything within the given days they have. But I'm glad to see the will and the commitment, to finish this, and they're trying their best. Thank you.
Dr. Tedros, first question in a row here.
Stefan Bussard, Le Temps newspaper. Thank you for holding this press conference. As a follow-up on the annex, what could you specifically, you didn't touch upon this, but what are the main roadblocks to conclude this annex? Will you extend it beyond WHA if there's no conclusion? And last question, if a consensus were to be reached, would that be a new model of inclusive multilateralism for WHO? Thank you.
Dr. Tedros, please. You want to? Yeah.
Maybe anyone would like to take also instead of...
Dr. Jeremy?
Yeah, you want to?
No? Yeah.
Okay.
Sure. Thanks. So I can start. So just to reiterate what DG has said, that the member states that are down in that room are really negotiating in good faith. There's a lot of room where they do converge in terms of what they agree upon, and remember all of the elements which are in the pandemic agreement. Certainly within PABS, a lot of the discussion is on access and is on benefits as well. Discussions around how the databases will work, how the WHO coordinated laboratory networks will work, and essentially how are the member states going to work together in multilateralism to bring together early detection, characterization, understanding what these pathogens actually are, and then linking them to what is critically needed for life-saving support, diagnostics, therapeutics, vaccines, and other medical countermeasures. And I think what we're seeing in the room, you have public health professionals, you have lawyers, and turning technical concepts into legal text is quite challenging. I'm not a lawyer. We do have a lawyer on the panel up here who can address that. But as the DG has said, they're really coming together and working to see how they can actually turn a concept into pandemic preparedness, readiness, response, and particularly access and benefits in this PAB system into a legal text that can be adopted by countries. So that's a challenging aspect, and it shouldn't be, underestimated. But the people that are down there have been in that room for many months, many years now, and really working hard to come together to address particular issues as it relates to the timeliness of the reporting, how the lab networks are going to work, the capacities that are necessary, the support of capacity building for detection characterization, and of course, the different types of contracts that would be required to be able to ensure that the system is working and that the access is linked to the benefits.
Thank you. And Dr. Sylvie Briand, no? You wanted?
Yeah, just to complement what Maria said is that we had a similar discussion a few years ago after the influenza pandemic, and it was the PIP framework at that time that was adopted. But this discussion in 2011, when it was finalized, was somehow easier because it was only on one pathogen. It was influenza, and we already had some structures in place for flu because we had 3 pandemics in the last centuries. So we were not starting from scratch, basically. But for COVID, it's and after COVID, so there was this this need for a pandemic treaty to really institutionalize collaboration at global level. And it's much more complex because we are not targeting one pathogen only, but many pathogens with pandemic potential, and including pathogen X that we still don't know where it will emerge, when and how, or if it will emerge. So it's much more complex because they are trying to develop a legal text, which is something very precise, on and to shape a future that is very uncertain and still with a lot of unknown regarding not only the pathogen that could emerge, but also the technologies that will be used in the future to detect pathogens and to treat or to prevent infectious disease. So because the science is evolving so fast nowadays, it's an additional layer of complexity, I would say, in the negotiation.
I picked up one thing that Stefan said, I think, and he said, will you extend it if it's not successful? I think this is a good moment to point out it's a member state-led process. So does anybody want to comment on that? Dr. Brion, Dr. Theros?
So on that, I think the IGWIG members will see their progress, during this session and look for the options they have. And then, of course, they will decide. And there are many options. For instance, one, they may finish it now. Second, maybe another session before the assembly or session after the assembly. So there are various options, actually, they will consider. But they will see whether there is enough progress during this session to conclude it now. Or not, and it's based on that they will see for other options. But so far they're trying to push to conclude it now, and we're hoping for a breakthrough. But it's as you know, negotiations are difficult, up and down, and some of the issues are very important. For instance, on public health emergency of international concern, whether the set-aside should be put for general FIC or FIC of pandemic potential, or in terms of access to data and materials. And there are also differences in there. And of course, on the benefits and access in general, there are areas that need to be addressed. Then in terms of I think how this will improve the inclusive process. I think it will improve significantly, because when we had COVID, there was nothing, and this will be a significant improvement compared to our situation during COVID. But I also want you to see this in relation to the reform we have started. By the way, in the middle of COVID. The Berlin Hub, for instance, to improve surveillance was established in September 2021. While still fighting COVID, we were building the future. And that was the most important thing. When did we start, and what have we been doing? And then how do we bring all this then to finalize this comprehensive reform, of course, with the pandemic agreement. So if you like, the pandemic agreement is, of course, the central, but many of the parts have been under construction, and they're going well. I was in Berlin a couple of weeks ago, and there's significant progress, actually, in how the Pandemic Intelligence Hub is handling surveillance. It's very different from what we used to do. So we need to see all this into. It's not just the pandemic agreement only, although it's central. There are many reform initiatives we started based on COVID lessons, and a handful actually, and they're progressing well. And the situation will be really different from when we had COVID, but that doesn't mean they're enough. We will continue to build, and change should be constant in order to strengthen our preparedness from time to time. Thank you.
Thank you, Dr. Tedros. Sigrid Connor, you wanted to add for Director Governing Bodies.
Thank you so much. Just to clarify, this is an open-ended working group, and actually its work is foreseen to continue beyond the agreement of the PAPS Annex, because the period in between this agreement and the creation and establishment of the Conference of the Parties is covered by the working group, actually. So it will definitely continue.
Thank you so much. Thank you, DG. I have two questions, actually. The first one about Lebanon and the new report of IPC about the acute food security in Lebanon. There is 1,002,000, I think, 100 of people suffering of food, the food insecurity. So my question, if you have registered cases of malnutrition between children, and how is the situation on the malnutrition there? And the second question is about Médecins Sans Frontières report about the use of water as a weapon of war. If you have any comment on that in Gaza, by the Israeli military, if you have any comment on that, and if you can speak a little bit about the situation there. There is more attacks registered this period, and I think also the situation of the malnutrition too is very critical there. If you could speak a little bit about that. Thank you so much.
Thank you very much. We have two colleagues online who should be best set up for this. This is Ian Clark, first for Incident Manager for Emergencies Program, especially also now for Lebanon for your part. And then we have Dr. Nabil Zabal, he's Incident Manager for OPT. So maybe let's start with Ian Clark, if he's on. No?
I think I just saw it of IPC about food insecurity in Lebanon and the level of malnutrition. Thank you.
Do we want Altaf? Could you say something on this? Or
yeah,
let's start with Altaf as long as we're
very briefly. I know we're waiting for Ian and Nabil to come online. So the IPC is the standard tool that we use across the board in all emergency settings, and this is a joint methods with FAO and the World Food Programme. So if we look at Gaza specifically, we know that in Gaza more than 2 years ago, the IPC has been declared in several phases, and there was a declaration more than a year ago of IPC 5. Since then, the key indicators of reversing some of those losses are the availability of food, humanitarian assistance, and the ability for us to be able to treat severe and acute malnutrition. Clearly, in the case of Gaza, that has not happened. We don't have assistance at scale. Freedom and movement and access to healthcare is highly restricted. And we know in the case in point of Gaza specifically, shelter as well as to the point on water, critical factors for survival are not there. So we want to be clear about this. In the case in point of Gaza, assistance doesn't go to scale. We continue to look at different points of entry to provide assistance as a humanitarian community at large. And that has not happened at scale. There are specificities in terms of making sure that children have access to acute and severe malnutrition support through therapeutic feeding centers. And when you look even at the overlay of the functionality of healthcare, I want to remind everybody here that since the start of the war, there's been no fully functional hospital in Gaza. So in addition to hospitals, you have a network of primary healthcare centers, a wide range of institutions who are supporting that with local authorities, with UNRWA. And again, the deregistration process, which has been delayed, also all these elements are having a deep impact on healthcare providers providing assistance when needed. In the case in point of Lebanon, again, it's quite natural that we overlay the IPC tool as a construct to understand scale and severity of risk associated with malnutrition amongst larger risks. Dr. Tedros has pointed out here again, the system is being collapsed because of attacks on healthcare, because of fuel and medicines availability in southern Lebanon. We know that there are a number of health facilities have had to shut down as a result of. We are tracking displacement that's happening north to south, south to north. And clearly when you have concentration of displacement, a wide range of public health risks are there. So we will continue to track that public health risk, particularly for children and mothers as this conflict continues.
Thank you very much. That was Altaf Mouzani, our Director of Humanitarian and Disaster Management. We also have now managed to get our two colleagues online, so we'll start with Ian Clark, the Incident Manager, please.
Yeah, hi, thanks, colleagues. Hope you can hear us. So we actually only got the last couple of words of the question, but I understood from the answer that Altaf was giving around the IPC report. So nothing from my side to add to what was said. But if there's any additional clarifications, then yeah, we can come back, myself or Nabil.
Thank you very much, Ian. And let's see if we want to switch to Nabil, or let's try Nabil, please.
Sure. So I will talk a bit also about, just to add on what also I missed the question, so sorry for that. But the situation in Gaza, as Altaf was mentioning, is also in terms of malnutrition, the situation is still fragile, especially with the drivers of malnutrition, and the challenges that were existing before the ceasefire continue in terms of access, in terms of supplies getting inside Gaza, and this is also due to the continuous restrictions that are also ongoing, and this is also linked to as well to the dual-use items. In terms of metrics for Gaza, since January, we continue also seeing new admissions to severe acute malnutrition stabilization centers, 216. Bringing the cumulative to more than 1,800 since the onset of the escalation back in 2023. And we continue also, given the restrictions, to the families continue to face poor dietary diversity, which means that children are not receiving the nutrients that are needed for their healthy growth and also for the immunity. And this is also compounded by the high burden of disease and especially infectious diseases that are driven by the conditions in the collective shelters. As you know, the majority of the population still live in makeshift shelters. So this is the situation in Gaza. As for Lebanon, and also given all the drivers of malnutrition and the new IPC analysis that revealed more than 1.24 million people, so nearly 25% of the population are also more likely to face crisis levels, so IPC 3 and above. I stop here and over back to your question.
Metro, and we continue with Dina, please.
Thank you. My question is also about Lebanon and Gaza and West Bank. WHO documented Israeli attacks in Gaza, West Bank, and it is spreading to Lebanon now, including targeting paramedics, blocking victims' access, and striking hospitals. We have seen a lot of decision taken by WHO during the last years, but what untapped mechanisms can WHO deploy to halt these attacks, which we may also call it war crimes, according to the international law? Another question is about the situation in Iran, the medical situation in Iran inside the country, and the question also about the risk of radiation in Iran and in the region, Gulf region in general, after the attacks on nuclear facilities, in case, and hope not, of course, in case it happens. Thank you.
Thank you very much, Dina, and we'll start with your neighbor, Altaf Moussani.
Thank you, Christian. So it's important to put in perspective, when we look at attacks on healthcare, we, since the establishment of our surveillance system, have recorded more than 9,967 attacks worldwide. Majority of these attacks take place in 26 countries and settings. Before the conflict in the Middle East, we were averaging around 3.7 per day. We're now up to 4.3. This is clearly showing that healthcare is the target. When we look at the impact of these attacks, we have recorded more than 5,000 direct deaths and more than 7,900 injuries directly involved in these attacks. These attacks include airstrikes and shelling on hospitals and clinics. These attacks include killing, injuring, arresting, intimidating healthcare workers. These attacks also include obstruction to healthcare, as well as the utilization of emergency services, and of course, looting and or militarization of health facilities. So that's all recorded in attacks. The World Health Organization, as directed by its member states, has the responsibility of generating this evidence and understanding where these attacks are taking place. We certainly advocate, and the Director General has been very vocal about denouncing these attacks and their impact as such, and calling for accountability. And I think this is a critical factor. Most recently, in a report a year ago, published by a range of authors, looks at that accountability agenda. And then most importantly, we equally look at providing best practice to prevent and or mitigate the impact of the attacks. And I think it's important to point out that when we look at the impact of attacks, the Director General has pointed out that when healthcare is needed most, it is being attacked. we've seen a 6-fold change and functionality of healthcare in places that is needed most. So again, giving you the example of Gaza, where zero functionality, full functionality of hospitals. We know that in the case of Sudan, only 54% of the health system is fully functional. And so these attacks are having a deep impact on functionality, which from an operational standpoint, both the World Health Organization, ministries of health, and their partners are working towards reversing some of those functional issues. But again, on the accountability agenda, I know the Director General has been very vocal that the World Health Organization does not hold the accountability agenda. We call for it, we ask for it, we demand for it, but we certainly work with partners who have that responsibility, both member states as well as international entities, and we look to them to call upon our data set, the evidence base in terms of what we're seeing. I'll let my colleague answer the Iran on the risk.
Do you want to go to Ian Clark on Iran?
Great, thank you. So yes, let me just cover a little bit on Iran. So I think clearly the 6 weeks of airstrikes on Iran has caused considerable stress to the health system. 3,400 plus people reported by the ministry of having been killed, and over 32,000 that were injured. Also massive displacement, more than 3 million people displaced. And as Altaf has mentioned, during strikes, some medical facilities have been impacted. And the attacks began, the escalation began. We had some emergency trauma kits in country, and these were distributed to hospitals. And now we are working again with the ministry to see how we can make sure hospitals that were impacted in terms of power supply have those in place. So we are doing a procurement process to actually support that, and also work around supporting mental health and psychosocial support and access to essential medicines for non-communicable diseases. So it's important WHO with health sector partners are working closely to support that and ensure that the system is able to maintain and cope should the hostilities continue. And just to say a few words on the nuclear. So of course this is not a surprise. We have been looking at this issue for several years, even prior to the airstrikes that took place in 2025. WHO works very closely with the International Atomic Energy Agency. They have the skills and the connections to verify if a nuclear release was to occur. And then of course WHO will focus, and our main concerns will be around the immediate and the longer term public health implications around that. And I think again it's not just on the nuclear, but also on other forms of environmental damage through petrochemical, pollutions, etc. And we saw this in the very early days of the airstrikes around Tehran with one of the large petrochemical fires and the black rain that fell on Tehran. So again, here WHO is working very closely with the ministries, and not just in Tehran, but in Iran, but also in Gulf countries, to ensure that we're able to support in terms of the clinical guidance around managing and treating mass casualty and events related to nuclear and other forms of chemical pollutants, and also importantly the public health messaging to be able to do that. So as I said, we're in very close contact with IAEA. We're monitoring that situation, and then we have, in terms of the clinical guidance, the messages are already in place should an event occur to be able to respond. So I'll leave it at that, but happy to come back if there's more clarification. Thank you.
Thank you very much, Altaf and Ian. Now, just to put you up to date here, I have 5 people now still on my list. That's Isabel, Priti, Olivia, Stephanie, and then John. So five still. That's good. Let's go. Isabel, please. And please don't forget introducing yourself.
Yes, sir. Isabel Saco with F Spanish News Agency. My question is on a subject that we were aware a few days ago. The Malaysian company Carex, the world's largest condom manufacturer, predicted that prices could rise by 20 or 30% due to disruptions in the petrochemical industry caused by the war in Iran. So the question is if you fear a general price increase for this product, and that if this can have a negative impact in the global reproductive health, especially in developing countries. And related to this is if you may have also other examples of products of health or health services whose prices have risen due to disruptions in the global supply chains, and in what measure this is affecting developing countries.
There are several questions in there. We may want to start with Ian Clark, Incident Manager, please, if we have an overview there, and then we see what we have in the room.
Sure. So thanks. So yes, I mean, we are monitoring closely the kind of the knock-on spillover effects in terms of the conflict, and I think it's a number of things. I mean, directly related to the question on condoms. Of course, the condoms, the manufacturing process comes out of derivatives from petrochemical, and the disruption in the Middle East area, and of course, moving supplies because of the Straits of Hormuz being closed is a major impact. I think it goes beyond just condoms, and where we have started now to do some inquiries and some research is looking into other products in addition, including products used for infection prevention and control, so rubber gloves, surgical gloves, gowns, masks, because again, all of these require some forms of petrochemical produce for those. Now, we don't yet have a very strong concept in terms of the broader impact, but that's something we're actually looking into, and certainly will be able to provide additional feedback as we go forward. But again, I think what we'll need to look at is other diversifying, looking at other sources where the raw materials can come from, and as we did in COVID, where there was shortages of supplies, WHO was positioned to be able to actually give guidance in terms of how to maximize the use of minimal supplies of equipment should that actually happen. But there are probably other colleagues on the podium who might be able to talk a little bit more about that. But that is definitely something we are very concerned about and following up and looking into. Thank you.
Sure. And we have Raul Thomas, please.
Thanks. So maybe I'll just add from the procurement perspective what we're seeing as that comes under my remit. We're seeing an increase generally across the board in all commodities, attributable not just to the raw materials, but also to transportation and other things. And even when we look at, for example, emergency health kits, some of the components within the emergency health kits are going up. So the long-term agreements that we've entered into, and a lot of this came out of COVID, right? How do we prepare and ensure that we have stability around pricing, around sourcing, and availability is being challenged now because those agreement providers, those holders of the agreements, are now coming back and saying our prices are increasing, and therefore they're passing it on to us. So we are continuing to negotiate, at least from a procurement standpoint, on how we can bring down a little bit the prices or reduce the increases, but we're seeing it across the board. So I just wanted to add that.
Thanks for these clarifications. Next question goes to Priti. Please go ahead.
Good afternoon, Preeti Patnaik from Geneva Health Files. I wanted to find out about, how the discussions on the reforms on the global health architecture are going, and really your vision as how you see WHO in the context of these discussions, because there are a lot of parallel reform dialogues going on. Thanks.
Thank you, Priti. Looking at colleagues who wants to start. Dr. Farrar?
Yeah, I'm happy to start. And there's to the structural way it's being handled. We now have, for a few weeks now, had the internal working group, which Bruce Aylward takes the leadership role, and Chikwe, myself, Razia, and colleagues from the regional offices and country offices come together. So on this, I feel very optimistic. I think there was, as you will know, some skepticism initially about the process and the ability to bring together various partners, member states, global health institutions, the role of WHO in all of that, the complexity of their boards and structures. But before this meeting, I just came from a meeting with strategic discussion with the Global Fund, for instance, and they have engaged very constructively in this, along with Gavi and Unitaid and philanthropy. I wouldn't be worried about the set of diverse initiatives that have been conducted over the last 6 months or so. That's very positive. Imagine the alternative, which was that there was one initiative trying to impose some uniformity across the system. None of those initiatives, I think, would claim to be the answer to everything. But between them, there will be answers to most things. And I think our focus over the next few weeks is the World Health Assembly to give us the mandate to convene a joint process of equal partners over the course of the next 12 months. And then to see within 12 months what reforms to the ecosystem can be worked on. And then is that a platform for going forward even beyond 12 months potentially, but keeping the focus on what can be achieved in the next 12 months. And just to say how critical this is, we established as a world over the last 20 odd years a series of very important, very successful entities. Looking forward, epidemiology of disease is changing, demographics is changing, science is changing, trust in institutions is changing, funding is changing. Middle and lower income countries are increasingly stepping up to do their domestic resourcing and wanting sovereignty over how they procure and other things. The world is going to change dramatically. And it is a celebration of 20 years of the institutions and WHO's contribution to those, and then saying that the future is going to look slightly different. It also includes the discussion on PABs, in my view, and what Maria was saying about coming together and Sylvie was saying around the PABs negotiation. This ecosystem is going to look different. We can either say, let's stick with what we've got, or can we try and improve it? And I think we're on the cusp of actually moving that forward now in a way that even, say, 2 or 3 months ago, I think was more difficult. It shows actually what negotiation and an inclusive approach can do, and that actually multilateralism and multi-stakeholder engagement actually can work. Sigrid may want to add to that because Sigrid is also part of this working group. Sorry.
Thank you so much, but I fully agree with everything you've said.
Olivia from Reuters, please.
Hello, thank you very much indeed for this briefing. A couple questions, if I may, just following on from my colleague's question about supply chain impact. Would you be able to detail the example where you're most concerned at a country level in terms of supply chain impact triggered by the situation in the Middle East? And maybe giving an example of how that impact is landing and what supplies are being impacted. And just just add on to that first question, I wasn't quite clear that the kind of inquiry into rubber gloves, etc., masks, procurement, is that because you've actually started to have reports on national levels of shortages emerging, or is that just a proactive look given, for example, the condom example? And also just a second question on budget. How is the World Health Organization faring now post US withdrawal, and what is the situation with I think there was a leftover payment by the United States. Forgive me if I've missed something in between, but I believe that's still outstanding. So an update would be really helpful on what the financial situation is currently facing the WHO with some numbers would be great. Thank you.
Thank you very much. And the first part, maybe Raul, you can go on.
I think
this
I'll
one.
start with the last part, and I'll leave my
that too.
emergency colleagues to deal with the first part. So on the financing, no, we have not received any of the assessed contributions from the US. However, for 2026, 2027, this biennium, we are 85% financed. And we have put in place a number of measures to also control our expenditures. So while looking at resource mobilization, we're also looking at tightening our belt. So we have a number of measures we put in place to do that. We have sustainability plans that are in place to ensure that we're quite prudent with the expenditure. And while we know that we'll have great difficulty mobilizing the last 15%, we are confident that we're going to be able to, if not mobilize the entire amount, but at least have our expenditures equal to the money that we actually bring in. And I have to say, one of the challenges we do have is the alignment of our resources with the program budget. So we do have what we call is pockets of poverty. So we have some areas that are overfinanced, some areas that are underfinanced, and that's why it's so important to have the flexible funding and the agreement of our member states some years back to increase gradually the assessed contributions of 50% is going a long way. The investment round that we had is going a long way. So a lot of the initiatives that we brought in around transformation are actually paying fruit now when we most need them. So all of the work that we've been doing in the Secretariat from 2019 until now around transformation is helping us to weather this storm as we go forward.
Thank you very much. Dr. Tedros.
I will add to that because the finance is important, although Raul had already said about the two issues raised. One, in terms of the arrears from the US, as you know, the US withdrawal is conditioned with two things. One is a notification, a notification 1 year in advance, which is actually met. And the second is paying the arrears. So we hope they will do that, but we haven't received anything yet. And then on the funding level, I think Raul had already said it. The finance reform we started as part of the transformation, the finance reform was one of the major pillars of the transformation. We managed to minimize the impact of the US withdrawal because we had already 2 installments approved by the member states. First was in May 2023 and second in May 2025. This has nothing to do with US withdrawal, but when we started our transformation, as you may remember, 2017-18, we anticipated that, if not withdrawal, we anticipated that some of the traditional donors, because we depend on few traditional donors, they may reduce their funding significantly. And that, as you know, causes shocks like now. And also, as you know, when you take money from a major donor, a big amount of money, it could also undermine your independence, because with that comes some, request. So the reform that we started, number one, is because of the 2 approvals by our member states, the impact of the US withdrawal has been minimized. So our financing actually is better without, if it wasn't without the reform, of course it would have been a problem, but with the reform, it's better. And as Raul said, 85% of funding for 26 and 25 is secure, for 26 and 27 is secured. But mobilizing the 15%, of course, is not easy. Just wanted to underline that. And we're not focused only on mobilizing the resources. We're continuing with the programmatic changes. So we want to continue to minimize our expenses so the total gap is reduced. So mobilize resources while minimizing our expenses. That will help us to move forward with stability. But the last part, which I wanted to also share with you, is not only it's helping us to fare better now because of the assessed contribution increase, but the future of WHO will also be defined by how successful we are in terms of the assessed contribution increases or the finance reform in general. When I say this, we expect 3 more installments from member states, and we know when this will be expected to be approved. The next one is May 2027. This is before I leave, and it will be, if approved, by the way, it will be a good gift to the new DG. That's May 2027. And then the 2 additional installments will be May 2029 and May 2031. This is one of the systemic problem we have, and we try to address it with a long-term solution. Imagine the reform that started in 2017 and spanning until 2031. Chronic problems cannot be addressed by what we do in few months, in 2 years, or in 3 years. There should be a long-term vision. And that's how this long-term vision is helping us not only to manage the crisis now, but also to put WHO on a better footing in terms of financing. Our assumption now is by 2031, the overall contribution of the assessed contribution, the most stable part of the funding, will reach between 50 to 60%. Then that will minimize shocks like now and can assure also our independence. So in that finance issue, it's not about money. You said it's finance. It's not about money. It's about preventing shocks like now, bringing stability, and also ensuring WHO's independence, because most of our funding will be flexible. So that's what we're trying to do, and the financing should not be seen in isolation. And as the saying goes, the economy is stupid. For many international organizations, it's the financing model is stupid. If the financing model is right, we get our independence as well, meaning we can do things without fear nor favor, because you know what's going on and you can understand what I mean. But this is a long-term vision that's delivering now to minimize the impact of the crisis, but also that will create a more resilient organization. And we're turning the crisis into an opportunity. Of course, not because of the crisis now, something that started even a few years preceding the crisis. Thank you.
So we triggered something here. Jamie has an immediate follow-up, please.
Thank you. Jamie, Associated Press. I just wanted to follow up on Olivia's question. Mr. Thomas, you mentioned the 15%. Where do you expect to mobilize that from exactly? And then, Dr. Tedros, you mentioned that you you have not received the money from the United States, but have you received any signals? What signals, if any, have you received from the United States that that money may be coming? Thanks.
Raul, Dr. Thomas, please.
Not doctor, mister.
Then just Raul Thomas, please.
So I think, look, we're looking at non-traditional donors, we're looking at international financial institutions and other ways to mobilize that 15%. So it's not that we won't go to the traditional donors, but I think we're expanding that donor base. We also have the WHO Foundation that is out there mobilizing resources for WHO. So looking across the globe at where we can actually make entry points, and our resource mobilization colleagues are working very hard in that space.
Do we have something on signals from the US?
On signals, no signals. We're hoping, I just said, we're hoping to get the money. So we're hoping to get the money, but no signals yet. Then no signals means maybe we may not be able to get the money. The likelihood could be not getting the money. Thank you.
Follow up, John Sarkostas.
May I add on this? To be honest, it's not about the money. Again, the relationship with the US, I don't want you to see it in terms of money. It's not about money. Actually, we have already managed to shape our budget, to design a new structure, complete the process already the past several months. We're stable now and moving forward. So it's not a money issue anymore. The issue is health security needs universality. And the US, by withdrawing, makes itself unsafe and the rest of the world unsafe. So it's a lose-lose, like what I always say. So our focus is not on the money, to be honest. The focus is on helping US to understand and reconsider, because health security needs universality. When there is vacuum, the virus wins. That's as simple as that. And it's global cooperation and solidarity, which is the best response. And that's why, by the way, we always say solidarity is our best immunity. So it's not the money. It's more the solidarity and the working together. And that's why we always ask for the US to reconsider, because of that, not about money. Money we're doing reform. For instance, US is saying WHO is not reforming. We are not only reforming, we even managed the crisis that happened because of their withdrawal, because of their reform, because of the finance reform. I think that has to be very clear. And going forward, I think the model for financing model we proposed is working, and the organization could be more stable. So the issue is about solidarity, not money. Thank you.
Thank you. I understand we have 3 more questions now on the similar topic, US financing budget. And then I think we forgot one from Olivia at the end. We'll be coming to that in the end. Now, do we keep the original order? Paula first, then Stephanie, and then John.
My name is Paula Gipalibias. I'm with Geneva Solutions. I wanted to, on the finance issues, I was wondering if there were any plans to make any further job cuts at WHO. Also, when would that be planned? Is that part of the plan, in trying to, if you don't get those 15%, would that be part of the plan? And then actually I have a question about PAPS, just going back, related to PAPS, and wanted to get your views on the role that the pharmaceutical sector is playing within those talks. I know that they're obviously not, at the table, but how do you see their role within those discussions?
Okay, so I can start. And so what we have done, and I mentioned previously about the sustainability plan. So part of this whole realignment and prioritization process is also to put the organization in much better footing, as the DG says, for the future. And the idea within those sustainability plans is we know if resourcing doesn't materialize at a certain point in time, we have certain actions to take. But I did mention we're looking at our expenditure. Right at this point in time, at this moment of speaking, we have no plans for a second wave. Everything, we are stable at this point. We are managing our expenditure, and we're looking at ways to use funding that may have been for activities to cover salaries in the most important areas. So I don't see a second wave, but I cannot say that there will not be additional layoffs in the future. And I think it's important not to confuse when people leave the organization because a project has ended. Because I think many times people report, oh, there's a layoff and it's attributable to funding. There is natural attrition in the organization. So as a program ends or a project ends, people do leave the organization. So we shouldn't conflate those two. But right now, I would say that we are stable and we're not looking at any second wave.
And maybe to add to that, the 15% also, we have more than a year and 9-8 months. That's one. And the second is, if we compare it to previous years, although the environment now is more difficult, previous years, same time, we didn't have more than 50 or 60%. This 85% is actually significant. So the amount we have is significant, and the remaining we have still a year and 8 months. This is not like immediate. So I think these two should be considered. And on top of that, another wave, we don't expect that because the situation is stable as Raul said. But one thing I would like to add, though, is we're continuing the programmatic changes based on our core mandate. And we want the organization to be even leaner than it is now. It can happen. It can be done. But this is through natural attrition over extended. This is for instance, there will be retirement. So we will consider seriously whether we need to replace or not. There could be people who would be transferred to other jobs. We always consider whether we need to replace that or not. And then, of course, based on the core mandate, since we will continue to do the prioritization, that will, of course, help the organization to be leaner, more focused on its core mandate, more effective and efficient. And you have heard about of course, you reported about the meeting with collaborating centers. We want to use more our convening responsibility as well, more and more. So to relearn on how to work through others. Because when WHO was established, one of the major mandates it has was convening, was not meant to do everything itself, but to do it through others, to work with others by convening. And we're moving more toward that, but that doesn't need another shock. We can do it through natural attrition. Thank you.
Thank you. So, Paula, your second question will also park like Olivia's on the supply chain, and we'll have two more, if I understand right, on the field of financing budgeting. Stephanie, next.
Thank you. It's Stephanie Dutt with ARD German TV. It's also on the United States. I have two questions on the United States for Dr. Tedros. Could you also comment on the United States shifting the funding to the bilateral memorandums of understanding, as we apparently have now 32 signed bilateral health deals? And my second question would be on the annex negotiations. To what extent do you observe misinformation campaigns impacting the current annex negotiations? Thank you.
Do we want to start with annex, maybe, Maria van Kerkhoff?
Yeah, so maybe take both of them. Okay, so thanks for both of the questions. So first on the role of pharmaceuticals. So just to say that the pharmaceutical industry is very engaged. They would love to be even more engaged in the negotiations, but of course this is a member state negotiation. So they have provided their input through stakeholder engagement, through side discussions, and they're supportive. We work with the pharmaceutical industry in PIP for the Pandemic Influenza Preparedness Framework. And again, they're actively engaged. They join us at our vaccine composition meetings where we give them the results of what needs to be in the influenza, seasonal influenza, and planning for pandemic influenza vaccines. So they're quite engaged with us on that and quite constructive. As you know, they have provided financial support, particularly for influenza. And of course, they're looking at how they will be involved in PABs to provide that financial support. But also they want to be active players in the benefits of the work that they do. So I would characterize it as largely constructive and really wanting to be engaged, and I'd love to be even more engaged. And while I have the floor on that, we have researchers that are involved, we have CSOs that are involved, we have many people that are supportive of the negotiations. And linking to the second question around misinformation, I think what's more in the room are technical clarifications necessary around legal language related to the operationalizing of PABs and the system that the member states are envisioning. If there are any comments in the room that relate to information that is either incorrect or comes into the room through misinformation, the Secretariat will provide any inputs, as requested, but also they're exchanging with each other. So the people that are in that room, the member states that are in that room have a tremendous amount of experience in pandemic prevention, preparedness, readiness, response, on legal aspects, on policy, and so they address these questions with each other as well. So I don't necessarily see it as misinformation or even disinformation in the room, but really a lot of good technical exchange and wholeheartedly wanting to understand how a system can operate in the complexities in this world that we actually live in, and taking into account changes in technologies, changing in geopolitics, changing financing with much of the money moving from health to defense. So there's good conversations there, I think, across the board.
The bilateral agreement, can you rephrase the question, maybe? Yeah, sorry.
Yes, I was asking for a comment on the current extent of the bilateral agreements, as we apparently now have 32 bilateral health deals that the United States managed to get.
So there was also a question about whether WHO is worried about it or not. Probably that's what you're trying to say, yeah? The bilateral agreement, I think we have said on many occasions that I think the US has the right to have a bilateral agreement with any country it wants. And any country actually has the sovereign right to have bilateral agreement. So we have no issue with that. But at the same time, bilateral agreement can coexist with multilateral agreements as well. And that's what we have seen, as our, anyway, of our experience indicates. But there are concerns that the bilateral may undermine multilateral, which I don't think so. And to be honest, I'm not worried because I said it earlier, health security needs universality, and you cannot reach universality through bilateral. Of course, there could be some national interests that the US is targeting and other countries are targeting. They can have that, but they cannot replace the multilateral system because the multilateral system needs universality. Let's say there are 31 agreements now, even reach 70. I don't think it's more than the 194 we have, because it's the kind of universality like the 194 that can help us the best impact in terms of global preparedness and response, in terms of sharing information for that and the other things we do as global good. So I'm not really worried. The only worry part I have is if what he said, colleague, actually he already retracted, that if there was active undermining and going after the pubs, for instance, not to happen, or campaigning against that, that could be wrong. Of course, that's already addressed, so that's not. I hope that will not be the case also going forward. But with bilaterals, I think I don't have any problem, and I'm not worried, and they have the right, to be honest. In terms of investment, though, they know what they're doing, but what they were spending through the multilateral system was too little, actually. They can get most of the things through the multilateral system, even with shared contributions like what they have been doing and what they, yeah. Thank you.
Thank you. And Dr. Briand.
Just a small point on misinformation. At WHO, we differentiate disinformation, which is inaccurate information with intention to harm, and misinformation. I think on misinformation, there is no intention to harm. Most of the time is misunderstanding or what is at stake. And this is why I think your question on the PAPs are so important, because if you can relay good information, accurate information, coming directly from WHO and its member states, I think this would be a very powerful tool to address misinformation and help people to understand how this kind of agreement can benefit them for the next pandemic. Thank you.
For this clarification. John, if you allow, I'll address now a question of Olivia, and then you have the honor of the last closing question, if that's okay, right? So, Olivia, could you just rephrase briefly your something for you?
Yeah, of course. Thank you. Just be really keen to understand on a country level where you're seeing the biggest impact in terms of supply chain disruption caused by the situation in the Middle East. And if you are able to give us some examples of some of the materials and supplies that are either missing or in short supply, and just explaining why that is, where they're supposed to be coming from and the difficulty that you're having. And then my part two to that was just a clarification on what was said earlier by Ian Clark, the inquiry into rubber gloves, mask procurement. Is that inquiry being triggered due to some national health services flagging to the World Health Organization they are starting to see shortages or difficulty procuring these items, or is it through an abundance of caution given the wider disruption that you're seeing? Thank you.
Thank you, Olivia. Altaf?
Thank you. So I think it's important to take a step back. In 2025, we've seen the most shifts in ODA funding. And as a result of that, the World Health Organization has recorded more than 6,600 facilities in 22 humanitarian settings that have either stopped or reduced health services. So this is having a deep impact on women being able to deliver safely, children accessing nutritional services, those that are chronically or disabled accessing, again, routine care. we see this in particular in places like in parts of Afghanistan and in Cox's Bazar, where they're 98% dependent on external aid. So it's really important to understand the landscape that is in front of us. Again, as a result of all that, we are tracking roughly 53 million people in these 24 settings will not have access to healthcare. The question then will be, well, what's happening with them? And I think that's where we're working with local partners, ministries of health, and health cluster partners to understand where will people be seeking healthcare, and as a result, when they don't have it, what happens? I think so. That's important. Secondly, and I think Raul, you pointed this out, that when we look at the functionality of a healthcare system, it's not just the fuel. It's the water, it's the medicines, it's the protection of the healthcare workforce, it's the referral care, and here again, with the attacks on healthcare, with the violations of international humanitarian law and human rights law, we see that access shrinking. As such, particularly on fuel and essential medicines, we know that there are deep impacts that we're starting to record in places like Cuba, South Sudan, Somalia, Gaza, which is having a deep impact on the cold chain services, on the functionality of healthcare, particularly running surgical centers, on accessing therapeutic centers, on running on water and sanitation support. So, you know, again, as a major contributor in terms of supplies within the wider perspective, this is something that we're monitoring. Here again, whether it's we record stockouts of essential medicines or the functionality of healthcare, this is something that we monitor and report very closely.
For this, Altaf, and closing question, John Zachrostas.
Yeah, thank you very much. John with the Lancet and France 24 English channel. My question is to Dr. Tedros. Listening to these depressing statistics from Altif on my right, nearly 10,000 attacks on health. That's just from the reporting member states. If we include attacks in countries that are not reporting to WHO, I think the numbers are far higher, and we know which countries are not reporting. God knows why not. My question is, will the attacks on health be front and center at the World Health Assembly so your message gets through to ministers of health? And secondly, will you be taking this message to the G7 summit and putting it on the agenda for world leaders? Thank you.
Yeah, thank you very much, John. This might be something straight for the Director General, or anybody else wants to jump in first? Altaf, maybe?
So it was actually in 2016 that member states came together and brought together what is called Resolution 6520. That established the surveillance system for us to record violations of healthcare. I think the uniqueness that the World Health Organization brings is every incident is verifiable by the World Health Organization. We're the only UN agency that has that mandate, but we're not the only mandate that's out there. We happen to be celebrating the mandate of the Security Council known as 2286, happens to be 10 years, also looking at violations of international humanitarian law, particularly on healthcare, but also on schools and educational systems. What Dr. Tedros has been repeatedly saying is that this is becoming normalized. And so there are several conversations through member states, particularly on IHL with ICRC, that will convene at the end of this year. Dr. Tedros has been repeatedly, even as going into this assembly, but prior to, saying that we must not make sure that healthcare is being a target and protect not just the system, but the healthcare workers that are providing this day to day. Ambulance drivers, EMT workers, vaccinators. And I think there is a collective responsibility amongst all healthcare workers, but also those who are responsible for providing that safe space to ensure that safe space is there. So you're absolutely right that the 9,000 that I mentioned is probably an underestimation. We know that our system doesn't necessarily capture all those violations, and we look to our health cluster partners as well as member states to feed that system. And again, the uniqueness is that we bring to the table is that we verify these firsthand. But we can't just record this data for the sake of recording the data. And again, without quoting the boss here, he's repeatedly said that parties of the conflict must be upheld to the rules of engagement, particularly on IHL and human rights. But I pass it to Dr. Tedros.
Yeah, thank you. So the World Health Assembly, of course, we will report on this, and I'm sure it will be significant enough. And we will also share our concerns because there is no accountability. That's why, as I've said, it's being normalized. There is no accountability, then the impunity continues. But it will be part of the report, especially the growing, unbelievable level of attack, of course, has to be reported. And then taking it to other global whatever fora, whether G7 or G20 or other, of course, we should, especially when we talk about accountability, then we need to make sure that those who have the power to do that must also know what's happening. So thank you.
Thank you very much, Dr. Tedros and Altaf. Well, this brings us to the end of this briefing. Thank you all very much on the panel also to stay that long. This is very good. Please don't run away. First, we have closing remarks by the DG, and then we will have a family photo. So closing remarks from you, Dr. Tedros, and then, again, please don't run away. From my side, we'll send the recording globally in, as we said, in about 2 hours now.
Yeah.
So that's just for your background. Cheers.
So thank you for joining us and glad to have you and hope to see you soon in person like this. As I said, it feels different and feels better. So I'd be happy to, do it with more frequency with you. Thank you. Thank you. All the best.
Every business is asking the same question. How do we make AI work for us? No more waiting. With NetSuite by Oracle, you can put AI to work today. NetSuite is the #1 AI cloud ERP, trusted by over 43,000 businesses. It's the unified suite that brings your financials, inventory, commerce, HR, and CRM into a single source of truth. That connected data is what makes your AI smarter, helping you make fast decisions. Right now, get the business guide Demystifying AI free at netsuite.com/AI cloud.
5 p.m. Washington time with a conversation with President Biden's chief economic advisor, Jared Bernstein. Kaylee, his take on what we saw at 8:30 this morning and are about to see in this Fed meeting.
Yep. Less than half an hour to go until the decision. Chairman Powell will take the podium shortly after that. So now we turn to a special edition of Bloomberg Surveillance with Tom, John, and Lisa.
Welcome to the world of decentralized finance.
With the surge in Bitcoin, you have crypto stocks also surging.
Bloomberg's covering all things crypto, the people.
This is a political attack, and we must hold our elected officials accountable.
The transactions.
Really a record-breaking moment.
Bitcoin is the exit strategy.
And the technology.
Awareness is going to grow, and these things grow the overall industry.
Crypto as an asset class is here to stay.
Bloomberg Crypto, Tuesdays, only on Bloomberg.
Live from New York City for our audience worldwide, Bloomberg's The Fed Decides starts right now.
This is a special edition of Bloomberg Surveillance with Tom Keene, Jonathan Farrell, and Lisa Abramowitz. Bloomberg Surveillance, The Fed Decides.
Starts right now on TV and radio for our audience worldwide. Good afternoon, 27 minutes out from that Fed decision with equity markets at all-time highs on the S&P 500, breaking above 5,400 and positive on the session by 1 full percentage point. What a start to Super Bowl Wednesday. Alongside Tom Keene and Lisa Abramowitz, I'm Jonathan Farrow. TK 8:30 Eastern Time. CPI coming out cooler than expected and igniting this equity market rally and taking the bond market with it.
I liked what David Rosenberg said. He said just simple as this, eureka. It's finally the first visible sign for disinflation, the disinflation crew, that now's the time, and you see it in the market reaction.
Yeah, Mike Gapen of Bank of America agrees, Bramo. Expect more deceleration ahead. One giant leap for the Fed. More evidence the first quarter was an outlier. Q1 looks more and more like a head fake based on the inflation we've had so far.
One small step for the Fed, one large step for mankind at a time we're all looking for disinflation. When you look under the hood, this is the reason why people are getting excited about this. When you look under the hood, it was auto insurance cracking. It was shelter inflation that picked up a lot of people picked that apart and said that that was ready to go. Goods prices basically flat. Airfares, recreation, personal services, all of the prices on those things, at least the pace of increases declined. Now the question is, let's see Act 2. What is Jay Powell going to say to actually move the markets any further, other than just say, yeah, you see that? I mean, we can't declare victory, but yeah.
In about 25 minutes, you'll get a statement, some forecasts. 30 minutes after that, a news conference with Chairman Powell. Check out the price action. Let's start with equities on the S&P 500. We are positive, big time, across the board. On the S&P, through 5,400 at 1 full percentage point. In the bond market, the 10-year down 14 basis points. The 2-year down by almost 15. Tom, for 6 consecutive Fed days, the 2-year has rallied, and it continues today.
It's extraordinary. And the thing that's important, the mathiness I did on the Bloomberg terminal before we started, was to see, are we still in range? And I would say we are, but on a 426 10-year, you look at Ian Lingen at BMO Capital Markets, we're about a third of the way to his nirvana. We made it in, 2-3 cups of coffee. It's really moving quickly, but we're still in range. Will Jerome Powell take us out of the range and finally break through?
Yields down, dollar weaker. Lisa, euro dollar 108.39.
And now up we have Fed Chair Jay Powell. But before that, leading up to that press conference and the release of the decision, JP Morgan's Bob Michael will be with us, and Julia Coronado of Macro Policy Perspectives. They will be taking us up to that Fed rate decision at 2 p.m. Eastern. Then we will get the decision, and we will get immediate reaction from Mohamed El-Arian of Queens College, Cambridge, KPMG's Diane Swanka, and Bank of America's Michael Gapin. And finally, after the press conference, we will be breaking it all down with Kathy Jones of Charles Schwab and BlackRock's Jeff Rosenberg, and we'll be seeing if bond yields are trading around like penny stocks once again.
We can start slowly. Bob Michael of JP Morgan Asset Management with us around the table. Bob, good afternoon. It's good to see you.
Happy to be here.
What are you looking for now? It feels like the CPI report wasn't the appetizer for the main event. It feels like that was the main course this morning.
Yeah, I think there was a huge sigh of relief that came out of the Fed in Washington. I think Jay Powell is now holding all the chips. He can point to the labor market and say, hey, we're still at about 4% unemployment. That looks pretty good. We're meeting our full employment mandate. And look at inflation. It continues to come down. That glide path is intact.
Bob, I've got to ask, and I'll ask this of all of our guests today, because to me it's the arch question, particularly after Lagarde and the ECB. Are they still slaves to Greenspan's measured, where once they move, they have to move and be measured and be responsible to maintain credibility? Or can they actually pull off a pre-ex post rate cut, given all the noise that's out there?
I don't think they're committed to, once they start cutting rates, they have to go in a disciplined path, either every meeting, every other meeting. I think what we learned in 2015, they cut once, and then it was another.
Are you investing in municipal bonds that will fund roads and bridges? Think of Assured Guaranty's bond insurance as your guardrail. Assured Guaranty, a stronger bond.
Peter Piper persistently missed packages. So he scheduled his deliveries with Amazon Business.
Peter Piper picked peppers, but rhyme.
And positively prospered. Amazon Business, your partner for smart business buying.
Year, but well, they actually hiked, and then it was a year before they hiked again. So there's a lot of distance between Fed policy moves now. They've got a lot of tools at their disposal. We still have to remember there's the balance sheet that continues to run down.
Right.
Honestly, how excited are you for this afternoon? And I understand that you have to say you're very excited. This is going to be a tremendous decision and the most interesting news conference that we've ever seen. But, kind of to the point that John was making, did the CPI report kind of take the wind out of the sails? I mean, is there anything that he can really say to move the needle other than, we're sticking with this and don't ignore us?
Well, admittedly, I'm not as excited as I was at 8:29 this morning. So for sure, when you look at the complete picture of things, it's exactly what you see in a soft landing. On some days, like last Friday, you look at the data, you can identify parts of it which looks like the economy's operating at too high a pace. And then when you look at today's data, you can look through it and find things that tell you actually things are slowing down pretty quickly. When you put it all together, this is what you get in a soft landing. And I think he's best to come in, deliver the statement, answer a few questions, and then get the heck out of there.
Well, let's see if he follows your recipe. As soon as we got CPI, I got a note from Neil Dutta of Renaissance Macro. They need to get on with it. And he said, you know, they're going to get behind. And basically nothing moves in this linear way. Would you agree that the best course of action would be to even open the door to a July rate cut?
Well, that's one of the things I do want to hear from him. I assume he's going to confirm that policy is sufficiently restrictive. I assume he's going to mention that the law of long and variable lags hasn't been repealed, and they have to be vigilant to that. Would I be surprised if they threw in a rate cut in July? Today, no. Do I think they're going to do it? I think there's less than a 1 in 3 chance they do it. I think they're very much on course for September. I think it wouldn't hurt them to see a couple months more data and then make the decision then.
So in 20 minutes, as you know, Bob, all we'll be talking about is the dot plot. And it's probably the first thing Mike McKee's going to really talk about with any detail. We're trying to figure out where that median dot for 2024 comes down to. At the moment, it implies 3 cuts for this year. Does it come down to 2? Maybe even 1. What are you and the team looking for when you get the statement of economic projections?
The dot plot will be great. 2 is pretty much the expectation. It's our expectation. If it's 1 cut this year, then it tells me they actually don't look at the data and then go back and revise their dots. That once they're submitted, that's it. And if it's 3, it tells me, well, actually, they do take a peek at the data, and then they have until 2 o'clock. Maybe they'll go in and revise some of their dots.
So you're saying that it should be 3? Based on the data that we've gotten?
No, I'm saying that it should be 2, but if it's 3, it's because there's enough of the group in there that takes comfort from the slowdown. Probably they parsed through a lot of the labor market data, and they looked at the household versus establishment survey, and they're putting a little bit more weight on the household survey. So I can understand how you could have 3 dots, but I think we're going to get 2 rate cuts.
Pause, what you just said. Do you think they put more weight on the household survey? Unemployment up to 4%. I just wonder what you think that means for their forecast, because right now they've got year-end unemployment of 4%. What's that coming up to in 20 minutes?
I think it will tick up to 4.1%. We spend a lot of time looking at the household survey. What jumps out at us is over the last year, the increase in unemployed is just over 500,000, and the increase in employed is around 300,000. So there's a weakness there that's not reflected in non-farm payrolls.
So 272,000 overstates the strength of the U.S. economy, your view?
Yes, I think it's one metric of the strength of the labor market. There are a lot of other metrics to look at. I think when you look at the quits rate, you look at a lot of the JOLT surveys, when you look at average hourly earnings and how those are coming down, there's a lot of things in there to tell you that there is some capacity being built into the labor market.
That would be quite a statement if Chairman Powell echoes that in the news conference a little bit later on this afternoon.
It would open the door to a July rate cut. That is what I think.
You think so?
Yeah. Well, at least it would raise the question of just how many rate cuts they could go for if they start to say, actually, we are seeing a deterioration in the labor market at the same time that inflation is coming in.
But he doesn't need to do that. He could say for the 30th consecutive month, we've got unemployment at 4% or lower. Inflation's not at our 2% target. It's coming down towards it. It's not there yet. There's no reason to do anything right now. I'm going to the beach for the summer. Let's check back in September.
You're doing that, or Chairman Powell is?
Maybe we both should do that.
Maybe we should all be doing that.
Will you join us?
I'm happy to come, Bob, so long as you're paying for the house. Bob Michael at JP Morgan Asset Management is sticking with us. That decision is 18 minutes away. That would be quite a statement if he puts more weight on that and says it explicitly in this news conference.
Well, that would give some dovish fuel to the rally that we've seen in bonds, which has been what we've seen, frankly, in the past 5 times he's spoken.
Amazing. Make it day 6 potentially. Yields are down by 14 basis points on a 2-year. Every time they meet, this 2-year just rallies. And it's happened again for a 6th consecutive meeting. Coming up very shortly, we'll catch up with Julia Coronado of Macro Policy Perspectives. Your equity market at all-time highs. This bond market absolutely ripping. Live from New York. Good afternoon.
No city is immune from financial challenges, But with Assured Guarantees municipal bond insurance, investors' bonds can be. Assured Guarantee, a stronger bond.
Peter Piper persistently missed packages. So he scheduled his deliveries with Amazon Business.
Peter Piper picked peppers for rhyme.
And positively prospered. Amazon Business, your partner for smart business buying.
Bloomberg covers the world with unmatched reach and resources. From more than 120 countries, the moment news breaks, 24 hours a day. Bloomberg, context changes everything.
Morning, this is Bloomberg Daybreak Europe. I'm Tom McKenzie in London. These are the stories that set your agenda.
Taking you from the U.S. market's close to the overnight session in Asia. We'll walk you through what you need to know to kickstart the European trading day. Live from our European headquarters, we bring you the day's top market-moving stories, unmatched expert analysis, and on-the-ground reporting from across the continent. Tune in every weekday at 6 a.m. London time, only on Bloomberg Television.
This is Bloomberg News Now.
News when you want it at the touch of a button.
Another volatile day on Wall Street. We're seeing big moves.
All eyes on Capitol Hill as Democrats and Republicans prepare.
Today's job numbers casting doubt on the Fed's next move. Inflation remains front and center. And that's news when you want it with Bloomberg News Now. Get it 24/7 on the Bloomberg Business app, Bloomberg.com, and anywhere you get your podcasts.
Bloomberg News Now. Context changes everything.
From the beating heart of global finance, economics, and politics, and wherever newsmakers are moving markets, Bloomberg brings you conversations that allow for deep discussions and important insights. What do you think the future is for inflation? Is this a new normal? Are markets too optimistic? How do you worry about the things that are outside your control? How does the current fighting completely stop? I'm Francine Lacqua, and this is The Pulse, every weekday at 9 a.m. only on Bloomberg.
The Fed's not going to move. They can hold off.
Higher rates are working to bring down inflation.
The policy is working.
It feels like immaculate disinflation.
It is immaculate disinflation.
They're going to try to sound neutral.
They'll continue to say they're data dependent and that the data is murky.
Risks are skewed toward that one cut, 2 rate cuts.
1 or 2 times.
I don't think the market really cares whether we're going to get 1, 2, or 3 this year, as long as the next move is down.
The question is going to be September or December.
They're still going to be able to cut in September.
Cut in December. September and December.
September or December.
Trying to guesstimate that first move by the Fed, it's been a losing game. We tried, we missed. Others have tried, they've missed. The Fed's tried, it's missed.
Each individual Fed commentary will be far less important than the sum of all of their parts.
We're going to have to see what they say.
15 minutes away, we'll find out what they've got to say. That Fed decision just around the corner. Equities going into it, sitting at all-time highs on the S&P 500, on the Nasdaq. Quite a rally this morning and into the afternoon. On the S&P up by more than 1 full percentage point. On the Nasdaq up by 1.4. The Russell, the small caps up by 2.6. Thank you to the Treasury market. 2-year, 10-year, 30-year. Look at this for a rally. Yields aggressively lower. We're down by double digits across the board from the 2-year out to the 30-year. TK, the 2-year down 14 to 469.
Stay on this board. This is a really important board here on the 2-year yield to see it in 14 basis points. What's important here is everybody stews on this after the shock at 8:30 is the yield has moved further lower. John, it's out 3-4 decimal points, but nevertheless, there's a small oomph into this 2 o'clock decision here with the yield market betting lower yields, higher prices.
When this dropped at 8:30 Eastern time this morning, Lisa, we both said, let's see if it sticks. It's stuck all through the day.
This is the biggest decline in 10-year Treasury yields going back to December. We are looking at basically the biggest move since the pivot that Jay Powell put out there at the end of last year, which raises a question. Is this sort of a new sort of acceptance of the Goldilocks soft landing scenario that you're seeing certainly play out in the Russell 2000? How can Jay Powell add to that? Or does he just basically do exactly what Bob Michaels just auditioned for, saying basically, it looks good, yep, we're on track, we're still wary of risks, and thank you, goodbye, I'm done.
Do you remember last time the Fed met and I said it's whatever time it is in Tokyo, and they're very happy over at the BOJ and the Ministry of Finance? I can tell you over in France, they need to thank the CPI report in the United States, because that triggered a move in the French bond market as well. Yields across the curve lower in France, and a euro positive as well after being negative for the last couple of sessions. Just check out euro dollar. Dollar weakness today against the euro. Lisa, 108.39.
It kind of makes all of these efforts, especially by Emmanuel Macron, the press conference, all the rhetoric, the politicians, how much does that basically undermine all of that and the influence when in one session a CPI print can just completely undo it?
Joining us to discuss is Julia Coronado of Macro Policy Perspectives. Julia, that decision 13 minutes away. What are you focused on in the projections we'll get from the FOMC a little bit later this afternoon?
Well, I think as you guys were discussing, the data this morning is probably more important than what the Fed is going to tell us, because this is a data-dependent Fed. So I think based on what we saw this morning, more likely we get a 2-cut baseline rather than a 1-cut. And Chair Powell, I think he's going to try to avoid sounding as enthusiastic as he did last December and encouraging the market to keep running, and instead say, look, we still have some wood to chop here. This is definitely encouraging. We still think the tilt towards rates is downward, but we're not in a rush, and we're going to gather a little bit more data. Julie, I do think he has to take out that reference to lack of progress. We clearly are back on a path of progress, and I think they're going to acknowledge that.
How is economic growth? We've had this wonderful discussion. It's a parlor game, and I love the video that we had, September, December, see you in December, whatever the song was. Julia, Jim Bullard today of Purdue said he's got a 3.0% unemployment rate in West Lafayette. They can't get help at Harry's Chocolate Shop. SK Hynix of South Korea is putting $4 billion into Western Indiana. Is this a boom economy that Chairman Powell addresses this afternoon?
Don't upload your videos to YouTube. Upload to Restream, where we will live stream it to YouTube and all your platforms at once. Get ready for 5 times more engagement and views. Oh, the algorithms love streams and engagement, rewarding you with even more views. While you, sure that works, upload and stream from Restream.
I know my subscribers are struggling with credit card debt. When I was relying heavily on credit to dig myself out of a financial hole, it was difficult to manage all of my credit cards at once. If that sounds like you, consolidating debt with a personal loan could be the solution. With lower APRs than those credit cards usually have, and just one monthly payment, a personal loan makes it easier to stay on top of your finances. And I want to give a big shout out to Credit Karma for sponsoring this video. On Credit Karma, comparing loan options is free and won't affect your credit, which is so cool. They show you personalized loan offers based on your credit profile and help you see how big of a loan you could get approved for. So check out Credit Karma and take control of your debt today.
Well, I think the way to resolve the tensions you've just outlined is exactly what we've seen, which is a pickup in immigration. And that immigration is allowing the labor market to come into better balance. It's alleviating some of those shortages. And it's also alleviating some of that potential for inflation pressures coming from the labor market. So that's all kind of great from a macroeconomic standpoint. And Chair Powell has acknowledged that that has changed the way they think about growth potential. Growth potential of 1.8%. Well, that assumes very little population or labor force growth. That basically assumes about a 1.5% trend productivity growth rate and 0.3% population growth. We're running stronger than that. Labor force growth is running stronger. Immigration is fueling it. And, I think that boosts what we can see without causing an inflationary panic on the part of the central bank.
Julia, what do you think that's going to mean for the statement of economic projections? Do you think that the inflation forecasts stay the same? Does the unemployment forecast stay the same, to be basically the same as where it is right now at the end of this year?
I think they're going to have to bump up the unemployment rate forecast at 10. Again, basically saying that we've loosened, but we don't expect a lot more loosening from here. On the inflation side, it's a bit tricky, and they will have an opportunity to update after this morning's data. Probably a lot of them are going to take advantage of or took advantage of that opportunity. You're probably going to see a little bit higher, maybe a tenth higher relative to the March projection. But you know, today's data is a perfect example of how quickly things can change. Just as they changed in Q1, they're reverting back in Q2 with equal force. So those projections are only as good as the data ratify them.
Things have changed a lot over the last few days. It was only Friday we had that hot payrolls report, which we can talk about more in just a moment. Can I ask you about that? Actually, Bob Michael suggested that maybe this Federal Reserve puts more weight on the household survey. I just wondered, Julia, whether you'd echo those comments.
I was taught at the Fed to put equal weight on payroll and the unemployment rate. So both of them are telling us something about the labor market. And again, I think the way we square the circle is immigration, that you have a higher break-even run rate on payrolls required to keep the unemployment rate steady. So we don't take the jobs numbers at face value from the household survey. That's subject to population growth assumptions. But the unemployment rate is informative. And so it tends to be more robust to those population growth assumptions. So I think what we see is a labor market that has loosened from the tight labor market of a year and a half ago, but it's still healthy. It's still got strong legs, and you know what we've seen in the payroll survey that I like is the broadening out of hiring. It had narrowed down to 3 sectors in the second half of last year. We're getting a little bit of a broader base this year, and I think that's good news.
Let's bring Bob back into the conversation. Bob Michael, is that how you square the circle?
Yeah, I guess the question I have for Julia is which one of the surveys, the establishment or the household survey, captures the immigration surge that we all understand is occurring? Where is the immediate impact felt first?
So it's a great question, and the answer is really complicated, but I think in general, the payroll survey is thought to capture people that are earning money in the labor market in real time. Again, the household survey is a smaller survey, and the numbers of jobs really hinge on, they're applying the responses to an estimate of the population growth. So they're undercounting immigration. They're more likely to undercount immigration because they're basing it off stale estimates from the Census Bureau. And meanwhile, you know, the people earning money do show up on payrolls. Again, undocumented workers are undercounted in both, so it's a bit of a complicated story. But, you know, I think there have been some analysis out of Brookings and former Fed economists that, you know, kind of come to that conclusion that probably payrolls is picking up the immigration story better.
Bob Michael, when you talk to your short-term paper people, are we anywhere near close to where the joy of 5.x% money market funds drifts away? I mean, how much do we have to come down? How much does Jerome Powell have to jawbone us to where there's a rush of money into your world?
Well, I think once we see the first cut, then the market will start to project series. Then we'll all go back and say, hey, we
need a cut.
Yes, on average, they cut 200 basis points, and that will get money pouring in. I think for the yield curve to make sense, we've got to bring the Fed funds rate down to about 3 3/4, 4%. Then to me, the 5 and 10 year makes sense where they are. That doesn't mean once the Fed starts the rate cutting path, that money won't come pouring into the bond market and drive yields much lower than that, maybe through 4%. What I'm hearing when I talk to clients is there is a ton of money on the sidelines. Some of the biggest investors haven't come into this market yet because of the inversion of the yield curve and what it does to their investment dynamic.
At this point, Bob, isn't duration better than credit, given how tight credit spreads are? We were talking to Woody Caesar earlier this morning. And if you really do believe that a rate cutting cycle is getting underway, why not just go long duration at this point and forget credit, given how it's basically rallied so dramatically?
I have completely the opposite view. As I was listening to Julia, What I heard was the balanced labor market is the stuff that soft landings are made of. And here we are gliding right into it. And you have nothing to fear in credit in a soft landing. Corporate profitability is great in the investment grade space. We already know defaults are close to zero. Nothing's going to be under pressure. So can I see spreads coming in from 80 to 90 basis points where they are? For sure. Can they go down to 60 basis points where they were in the 95 to 98 soft landing or 04 to 06?
Peter Piper's pepper picking proved painful. So he ordered the supplies he needed from Amazon Business.
Peter Piper picked peppers, but run, rock, rhyme.
And positively prospered. Amazon Business, your partner for smart business buying.
If you need more hours in the day, if migration feels like a marathon, if data consolidation feels like a data disaster, if you have multiple apps for multiple entities, you need the Intuit ERP, the AI-native ERP that's powerful, painless, and proven. Intuit Enterprise Suite.
Absolutely.
Julia, I wanted to give you the final word. I wanted to borrow a question from Lisa from earlier this morning. Do you think there's someone on the FOMC who's shouting mission accomplished based on the last couple of months?
No. Central bankers don't shout mission accomplished.
They whisper it.
They go home to their spouse and sit down and have a quiet glass of wine and cheers with each other. They're not going to come out and say mission accomplished ever.
Julia Coronado of Macro Policy Perspectives. Julia, thank you. I'm just wondering how many quiet glasses of wine have been had. That's all. I'm just wondering.
It's just like a general feeling of quiet joy that they restrain with a little smile.
Remember where Chairman Powell was at the end of last year, right? And then we had this Q1, hot inflation story. A lot of people lining up to say that's a head fake based on the last couple of months. Do you think Q1 was a head fake based on what we've seen so far?
I think so, and there was a lot of discussion about that Q1 tends to run hot relative to the rest of the year. In terms of the Fed high-fiving one another, I caught this morning with Jim Bullard on. I don't see him doing laps around the Fed,
I didn't hear it
high-fiving
either.
everyone.
I didn't hear it either.
Yeah, go ahead.
Can we have a surveillance correction? Julie doesn't have a glass of wine. She has a Lone Star long neck out of the tradition of the University of Texas. But no, I don't think they're anywhere near celebrating. But after the shock of these other banks beginning to cut, they're behind. That's, to me, the lead story here.
They still have work to do. And this, to me, is the big takeaway. They have work to do when it comes to credibility. And the hard work begins now. How do they finesse this at a time of political polarization, at a time where they're going to be accused of all sorts of things? They might have achieved something on the economy, but credibility is still a question that they need to answer at a time where a lot of people are calling it.
There's a word you'll hear in this news conference repeatedly, which is confidence, and we need more of it. How much more confidence do you think they need? How many CPI reports is that? No doubt you'll have a reporter in the news conference that might ask the question. How many more do you think it is?
Not many. They have to be relieved. If there's one emotion, that has to be it. Things continue to play out the way that they had hoped. I think they'd like to see just a couple more months of employment not getting hotter, maybe a little bit of capacity building in through immigration, and prices staying about where they are. And then I don't think they're going to wait for the 2% inflation target to be hit. I think then they'll talk about the long and variable lags and begin fine-tuning policy with a rate cut.
I started the show this afternoon by quoting Mike Gapin of Bank of America, but I left off the conclusion. I'll share the quotes again. This is what Gapin has to say. One giant leap for the Fed made Bramo laugh. More evidence that 1Q was an outlier, but still thinks the first cut comes in December. Even with all that really constructive language about what we've achieved this morning, at least what they believe we've achieved this morning, Bank of America still believes the first cut comes later this year in December.
It sort of goes to the question that we don't know what confidence means, right? We're going to be parsing through every iteration, every word. If they need confidence, Bob, you were saying it doesn't have to be that much. But Tom, at a certain point, do they have to have more confidence given the noisiness, the speed bumps that you've seen along the way?
They're going to be exposed. I don't see many speed bumps. I see nominal GDP 5%. You help me with Michael Ferroli. Maybe it's 4.8%, whatever. But there's an underlying animal spirit that belies whatever first quarter GDP was, 1.3, 1.4%. There's more of an enthusiasm now that gets them in control to where to what they want to get. Maybe they didn't have control last meeting. He's got more control of the dialogue this meeting.
That decision is about 30 seconds away. Let's go through the scores going into that decision. Equity markets right now on the S&P 500, record highs. On the Nasdaq 100, record highs. On the Russell, a rally of 2.6%. In the bond market, which is where the fun and games have really taken place over the last couple of weeks, Lisa, back and forth, one narrative to the next, back and forth, day after day, from data point to data point.
Jim Bullard saying it concerns him, the idea that we're not seeing any kind of stability in the bond market. At what point does it become disruptive? Right now, we're still seeing that massive rally on the heels of a really positive CPI print.
With your Fed decision, here's Mike McKee.
2 dots, no rate move. The median of the 19 Fed officials' projection for rate cuts this year moves to 2 from 3 in March. Policymakers are quite divided, however. 8 members see just 2 cuts this year. 7 see only 1. 4 vote no change. They now have 4 penciled in for 2025. Although the range is so wide, it's almost meaningless. The neutral rate also moves up. The median now 2.8% from 2.6%, although they don't get there until after 2026. 9 members see neutral as 3% or higher, 1 as high as 3.75%. The Fed's target range stays in the range of 5.25% to 5.5%. No change in the 2.1% GDP projection for 2024, 2% for next year. No change in the 4% unemployment forecast for this year, though 2026 moves up a tick from March to 4.2%. It's PCE inflation where we see the biggest change in the forecasts. Headline of 2.6 this year, up from 2.4% in the March projections. Next year, 2.3 from 2.2. Core PCE is forecasted 2.8% this year, up from 2.6%. Next year, also 2.3 from 2.2. Inflation was the only significant change in the statement following today's better-than-expected CPI. The statement now says, in recent months, there has been modest further progress toward the committee's 2% inflation target. The decision was unanimous.
Mike McKee, thank you, sir. If you were looking for fireworks in financial markets, you missed it all. It happened about 6 hours ago at 8:30 Eastern Time. And the equity markets, some of these moves stick. On the S&P 500, still positive by about 0.9%. On the Nasdaq, up by more than 1 full percentage point. 2-year yields, Lisa, just off the lows of the session, but still down 12 or 13 basis points to 470 on a 2-year.
There's nothing that would really shake up what we saw earlier. It is interesting, though, that they did increase their expectation for core PCE inflation to 2.8% versus 2.6%. And it raises the question about the idea of, are they tacitly allowing inflation to go be 2 point something, to Mohamed El-Erian's point, rather than exactly 2%, as they allow this to happen even with 2 potential rate cuts baked in.
TK, what's your takeaway?
My takeaway here is that 8:30 was really, really important, and it moves us right on to all the other economic data. And I go back to economic growth, and it's a surprise this year that we get more buoyant economic growth than a lot of the gloom crew's talking about.
I want to get back over to Mike McKee. Mike, just briefly, just work through that again for us. Explain to us where that median dot is. We were looking for 3 cuts in the median dot last time around. Where's that median dot for 24 now?
Exam FX is the best choice for insurance pre-licensing training. Our new elite learning platform is intuitive, concise, and engaging, and built for a diverse group of learners. We offer live instructor support and live customer support to help you every step of the way. You'll pass your exam on your first try or your money back. We take the guesswork out of training to clear your path to success. We've trained 8 million learners over 27 years. Be the next one. Get started today. Exam FX, empowering success.
I tried a ton of AI work tools. Then I tried Monday.com. Game over. Monday.com is super easy to use and knows how to do AI right. I use it for insights and action suggestions constantly, especially on those back-to-back meeting days. And my team used Monday Sidekick to work up all kinds of marketing content for the different platforms. So stuff that takes my team hours is now done before they even open their laptop. All these AI features are built directly into Monday.com and actually use our real data. With Monday.com, AI isn't some over-promising future. It's here. It just works. Like, actually saves us time and resources kind of works.
Monday Sidekick, AI you'll love to use. Start a free trial today at Monday.com.
The median dot is at 2 cuts for 2024, 4 for 2025, but the range has narrowed considerably, but still broad, because there are, at this point, 8 members seeing 2 cuts this year, so that makes it the median. 7 saw only 1, and 4 voted for no change. So they seem quite divided, which would suggest that at this point, there is no consensus on the committee about what's going to happen the rest of this year.
Mike McKee, thank you, sir. Mike McKee will be in that news conference in about 27 minutes' time when it kicks off with Chairman Powell. Bramo, any early questions for Chairman Powell in this presser based on that?
Yeah, I do. Number one, how long will you tolerate inflation above 2%? How quickly is an okay pace to move to get inflation down? And the second thing, I'm still thinking about this. One participant had a new neutral rate proposal of 3.75%. That's pretty bold. I mean, it's pretty much in line with where markets are for 3.5%. Nonetheless, that resets a lot of questions about market valuations that maybe on the margins could really change investment theses.
Joining us now to discuss is Mohammed Al-Erin of Queen's College, Cambridge. Bob Michael of JP Morgan still around the table with us. Mohammed, I want to come to you first. Get your view on these forecasts based on what we learned earlier this morning at 8:30 Eastern Time.
So I wonder, John, whether those forecasts fully reflect this morning or whether they were finalized before this morning. I was surprised to hear that 4 voted for no cuts, and I was surprised to see the inflation numbers go up, both for the PCE, both at headline and core. So the one question I would have for Chairman Powell is, do those numbers and the expectations that 4 people had of no rate cuts reflect this morning's inflation data or not?
Mohammed Tamkeen, good morning and good afternoon, I should say. Good late afternoon and evening to you. Somebody today echoed Peter Orszag, a long time ago of LSE. That's a school, Mohammed, southwest of Cambridge. And Peter Orszag talked about glide paths. Is our great underestimation that the glide paths to get out of the pandemic with all this monetary policy is a much longer time frame than we think? We're modeling Fed meeting to Fed meeting, the silliness of September and December, where we should be modeling 2027.
We should, Tom, and I've been urging to combine data dependency with more of a forward-looking view of the economy, but that's not where the Fed is, and as a result, that's not where the markets are. The markets are reacting to every single data point. In the last month, just the last month, 10-year yields went up 30 basis points, came back down 40 basis points, went back up 20 basis points, and came back down 40 basis points. And what you realize is that there's no anchor. There's no longer-term anchor to markets, and there's no longer-term anchor to policies. We should be talking about the big secular changes and how that's going to impact the next 12 months, but that's not where the Fed is, and therefore that's not where the markets are.
Right now, I wonder how significant it is to you, Mohammed, that we did see at least one participant materially mark up their long-term neutral rate as people try to understand what this means longer term for what a Fed rate cutting path could look like.
It's about time. I mean, there is a very active discussion of what's happening in the structure of the economy and why it is that the neutral rate is well above 3, nearer to 4. But the Fed is moving very slowly on this, and Fed Chair Powell has refused to engage in discussions, either saying, I don't care about it, or I don't have a view about it. So, yeah, it's about time. They're going to have to really think about this. But again, Lisa, that is a forward-looking parameter. And this is a Fed that focuses excessively on the past and doesn't want to signal much about what's ahead.
So if you are just joining us, welcome to the programme. Equities still firmer by 0.9% on the S&P 500. We were higher by more than 1 full percentage point. Just undoing some of the moves in the bond market on a 2-year yield. Yields are lower still by 12 basis points. They were lower by a little bit more than that earlier on. There was a lot of interest in the median dot for 2024. Just want to clarify something that Mike was saying. They're now signalling they expect to cut rates only once this year, compared to the reduction of 3, which was kind of signalled back in March, Bramo. So that's the change we were looking for. Would we come down for 2 or to 1? It looks like we've come down to 1, but 2025 kind of makes up for some of that in some way.
Which is what some people were saying, is that you just basically push it out to the following year, which is why it might not have been a massive deal. There was a big question before this whether or not it would matter to markets on the margins. Maybe you take back some of the gains in certain bonds right now. Nonetheless, not a huge shift when you look at the overall cutting cycle.
Well, Michael, I've got the 10-year yield just touching 2 standard deviation move. It's not a big deal, 4.28% and gyrating around. What level of 10-year yield do you need to really signal, to use Bullard's word, a new regime?
Peter Piper persistently missed packages. So he scheduled his deliveries with Amazon Business.
Peter Piper, big peppers, but run, rock, rhyme.
And positively prospered. Amazon Business, your partner for smart business buying.
The Range Rover, the most desirable ever created.
It's not so much the 10-year yield as the front end of the curve.
Yeah, okay.
I think the front end of the curve, you've got to see the Fed start cutting rates and then the front end start coming down towards 4%. I think that will pull the 10-year down as well a little bit, but there's an awful lot priced into the 10-year part of the yield
curve. This is an
curve.
unfair question. I'm going to ask you to speak for Michael Feroli and Kasman and the other economists at J.P. Morgan. Do they do harm to the American economy by being ex post and delaying? What would your economists say?
They do no harm to anyone, that I'm pretty sure of. Look, I think when you look at market movements, you have to understand that there are different constituencies that are involved. We talk to a lot of very large plans that are waiting for the yield curve to disinvert because based on their investment analytics, it doesn't make sense for them to come out of cash into the longer end of the curve. There are other buyers out there that are looking to park cash into safe dollar assets. So they're big dollar buyers, they want to own the dollar, and treasuries are the largest, most liquid way to do that.
I have to say, I'm parsing through the statement and all the details, and it's a confusing one. So let's just go over it. 4 Fed officials see no rate cuts this year. That is up from 2 officials in the March projections. So that is a more hawkish tilt. 7 see 1 cut, while 8 see 2 cuts. Honestly, we're looking at right now a narrow majority seeing no more than 1 cut this year as a base case. This, according to the statement. I'm looking at this and I'm wondering, John, all the people who said this would be some kind of massive shift, it isn't being taken that way by the market as people parse through the longer term expectations for what the Fed hopes to accomplish and where the balance of risks is.
Because we had a soothing number at 8:30 Eastern time. I think that's kind of the takeaway. Yeah. Is that right, Bob?
Yeah, I think so. It's what I started with. This is what you look for in the numbers. If there are a lot of people clustered around 1 dot, then they don't change their projections after the number. They've submitted them, they let them go. The fact that there were 4 with no change, 7 with 1 dot, and only 8 with 2 dots, 2 rate cuts, tells me that they submit them, they don't do anything. The statement's completely different. The statement talks about modest progress continues to be made on inflation.
Let's get Mike McKee back into the conversation before Mike goes into that news conference. Mike, just to clarify some of the comments you had earlier, your thoughts?
Well, I misspoke. But 1 cut is the median dot this year for this year. But it is, as you say, somewhat confusing because of the way they do it. But looking out over the course of the year, the question is, when do they do it? Because their PCE projection is basically for the year where PCE is now. So that's going to be a question for Jay Powell in his news conference.
Mike, you get into the presser. Thanks for your time, sir. Happens to all of us. Looking forward to your coverage in that news conference with Chairman Powell a little bit later. Diane Swank is with us from KPMG. I want to bring her into the conversation. Mohammed's still with us, Bob Michael as well. Dan, you've had about 15 minutes, 10 minutes or so to go over these numbers. What jumps out for you?
Well, certainly the upward rise in inflation I was surprised at. I expected them to mark down inflation a little bit. So that is one that I think Mohammed also flagged. But I think what's important is we know that they've delayed the marking down of their dots on the dot plot, and that has become more of an iterative process to reflect more of a consensus of what they do talk about at the meeting. So I'm not sure that there's the dissonance there that some would like to see in those numbers between today's data and those actual dots. I think what it probably did was took out of play some people who might have had hikes in their interest rate scenario for 2024 that then moved them to the zero portion, those 4 people who voted for no change in rates. But I think that's very important, is that the Fed has also been very careful not to declare victory, as Julia said at the end of the last show. And I think that's really important. They don't go out and say mission accomplished. They are very deliberative right now in terms of not getting too far ahead of themselves until the data comes to them. Now, I disagree that that's, sort of neutral and doesn't cause any harm. Data dependence, the data are lagged. And so by the time the data comes to you, even if you're willing to settle in to a higher rate ultimately, it's still lagged, and it could be after the fact. And I think that's what you see in terms of the nervousness with Jay Powell, because he worries much more than some of his colleagues about over-tightening.
Diane Swank, I look at where we are, and what the key thing is, as Bob Michael said, is we're beyond